Καλημέρα σε όλους. Καταρχήν να ευχαριστήσουμε λίγο για την παρουσία σας εδώ. Νομίζω ότι θα είναι μια πολύ γόνιμη και σημαντική ημέρα. Δυστυχώς όμως, επειδή είναι συνάδελφοι από την Ευρωπαϊκή Επιτροπή που μας βοηθάνε πάρα πολύ, θα πρέπει οι ομιλίες να γίνουν στα αγγλικά, όποτε θα μας συγχωρήσετε να το κάνουμε στα αγγλικά. First of all, I would like to thank you all for being here today. It's a great honor for us, for the Ministry of Digital Governance, because we try to organize this event to get knowledge and experience from the European funded programs. So I wouldn't like to spend your time more. I would pass the floor to the Secretary General, Mr. Professor Christopoulos, that he's the Secretary General of Information System and Digital Governance. Afterwards to Mr. Kyriakos Tolias, that he's the Director of the National Documentation Center, and Mr. Aris Angelis, that's Secretary General for Ministry of Health and Strategic Planning. So, please, Professor.
Hello, everybody. I would like to welcome you to the Ministry of Digital Governance, which is hosting this event, and thank you very much for participating. I would also like to thank our colleague from Ministry of Health and the National Documentation Center and the EU, and of course Mr. Stasis, who is the contact point from the Ministry of Digital Governance for this initiative that we're here today for. Now, this ministry is a contact point for the Digital Europe program, as you may know, and we're very happy to actively participate in this committee. And we're responsible also for the digital transformation of the country. As you may know, Greece has made considerable steps in the past 5 years in this effort to transform. We have launched GR, which now embraces more than 1,500 digital services. We have launched the Interoperability Center. We have embraced the cloud-first policy in Greece, and we also have a number of initiatives such as the wallet, the national wallet, now operating, which is really very handy, and a couple of other things that kind of make us proud for what we have achieved in the past 5 years. That's why our transactions that we count, transactions with businesses and citizens, that we counted in 2019 were originally almost 40 million, and now we count more than 1.45 billion transactions. Of course, using a different methodology, but the fact that we have multiplied considerably the transactions performed by citizens and businesses. Now, in regard to this discussion and Info-Day that we're having today, the HaDEA Info-Day, we are also chairing 2 working groups, namely for Connected Public Administration and the Interoperable Europe Act, and of course the Cybersecurity Academy. So as a national contact point, we're informing all Greek public authorities, research institutes, which are also present, academia, regarding new calls and funding opportunities, which is of crucial importance, as you may all understand, and provide support whenever this is required. So in this Info-Day, this is very important. This Info-Day is relatively important for us because it may help us towards identifying new funding opportunities that can help us towards the digitization of the country. Also, identify new partners that have common interests and, of course, exchange experience and best practices. Last, find answers to common issues that we need to tackle during this preparation of the proposals and the implementation of all projects. And since I come from the academia, I'm a professor myself, as Mr. Stasis just said, yes, it's very important to promote the cooperation in Greece also between governance and public administration, that is, and universities and also enterprises. We are currently working very hard on this. In this respect, I hope that this would be a very fruitful day for all of us, all of you, and all of us, of course. And I would like to congratulate also the Ministry of Health and my colleague for joining this Info-Day and kind of hoping for the best and don't just be here today, but collect all the necessary results and conclusions and prepare for the next day in the best possible way. And we also hope to have the National Documentation Center, Mr. Toyas, helping us towards this direction. So thank you very much, and thank you for being here with us today.
Thank you very much. Good morning to everybody. I extend my gratitude to all participants joining us today for the Info-Day on the European Health and Digital Executive Agency funding programs dedicated to health and digital transformation. We are truly honored to co-host this event with the Ministry of Digital Governance and the Ministry of Health and, of course, the European Commission, marking a significant milestone as the first of its kind in our country, with the collective involvement of these key stakeholders. A special acknowledgement goes to our esteemed speakers who will provide comprehensive insights into the Horizon Europe, Digital Europe, and Connecting Europe facility programs. Allow me to briefly highlight the National Documentation Center's commitment for 3 decades to supporting Greek research teams in engaging with European Commission initiatives. Serving as Horizon Europe's national contact point for clusters 1, health, and 4, digital industry and space, as well as for the cancer mission, we uphold our pivotal role within projects such as the Enterprise Europe Network, EIT Health, and other European networks. We remain steadfast in our dedication to offering a diverse array of services, fostering collaboration, and providing essential resources to both research and business communities. Our highly skilled personnel is committed to offering information, facilitating networking opportunities, and delivering guidance and mentorship to stakeholders throughout their research journey. As we envision today's event as the first of many, symbolizing the strengthening of collaborative efforts among agencies, I extend my heartfelt appreciation to each of you and convey my best wishes for success in all your endeavors. Thank you.
Right. Good morning, everyone, and thank you for the kind invitation to be here and present the Ministry of Health. So, as we know, the programs implemented by the European Health and Digital Executive Agency, HaDEA, are a very valuable contribution to the national program for digital transformation in healthcare, currently in progress and mainly financed by the resources of the Recovery and Resilience Fund. The Ministry of Health and the Ministry of Digital Governance are collaborating diligently, putting forth significant effort to overcome challenges and successfully deploy the necessary reforms for the digital transformation in the sector. The Ministry of Health is actively engaged in HaDEA's funding mechanisms, EU for Health, Digital Europe, and Horizon, in order to take full advantage of the opportunities offered and enhance the collaboration among member states. Each program complements the others, EU for Health focusing on system resilience and health challenges, Digital Europe on technological infrastructure and digital transformation, and of course Horizon Europe on pushing the boundaries of science and technology in health. And I should also mention here a personal story, because I have been personally benefited from not Horizon, but FP7. My PhD was actually funded from an FP7 funded project, right, while I was at LSE. So I have personally experienced the benefits of such funding schemes. So as a recovering academic, right?
So you're older than you.
Possibly. Possibly. So all these programs collectively contribute to a very holistic approach, if we put it that way, to improving healthcare, right? by integrating advanced research, digital transformation, and public health initiatives. So currently, the Ministry of Health is concentrating on aligning with the European Health Data Space Regulation and is also prioritizing initiatives like the EU Beating Cancer Plan. The Ministry is leading all associate efforts, orchestrating the activities of all crucial stakeholders, and is developing the required legal, regulatory, and technical frameworks. In this context, the Ministry of Health and the Ministry of Digital Governance, are among other various organizations under their supervision, are effectively managing different projects under HaDEA. Specifically, the General Secretariat for Strategic Planning at the Ministry of Health, tasked with overseeing digital health activities, serves as the competent authority responsible for establishing the infrastructure for the National Health Data Access Body for the secondary use of data, whereas the General Secretariat for Public Health is overseeing numerous joint actions that implement the EU Beating Cancer Plan. It's also important to highlight that Υγεία, a very valuable and experienced partner to the Ministry of Health, plays a key role, a vital role, in digital healthcare transformation projects. At this point, it should be noted that while the EU's financial support is very significant, it's still not adequate for initiatives of this magnitude, such as the harmonization with the EHDS regulation, the AA Act, and the Beating Cancer Plan. Consequently, further funding seems to be necessary. Perhaps the distribution of different available resources to fewer projects that could benefit from greater budgets could be explored, or potential additional funding resources could be investigated. Moreover, it should be mentioned that beyond the technological needs, substantial legal and regulatory efforts are necessary for the harmonization with the recent emblematic EU acts like the Xt-EHR and the AA Act. So we welcome HaDEA to Athens, and we look forward to a lasting and fruitful collaboration towards transforming digital healthcare. Thank you very much.
Okay, I would like to thank Professor Demosthenes Anagnosopoulos, Secretary General of Information System and Digital Governance, Dr. Aris Angelis, Secretary General for the Strategic Planning of the Ministry of Health, and Mr. Kyriakos Tolias for this support, political support to this event, and of course to all the actions that we do towards this supporting this project. I would like to pass the floor to Ms. Marina Zahni to give us an overview of what HaDEA is doing.
So thank you very much. And before starting, I would really like to thank the Ministry of Digital Governance, the Ministry of Health, and the National Documentation Center for having allowed this event and for inviting us, HaDEA, a relatively new, I would say young agency, to present the agency itself and the funding opportunities in the different programs. And thank you to all the audience and participants to be here for sure. I'm not here alone. I'm not going to present all my colleagues, but practically 2/3 of the first seats are colleagues from HaDEA and colleagues from Commission Services, because we are really working hands in hand. So I will give, if you allow me, a general I'm Marina Zanchi, the director of HaDEA. So I will present briefly, when the slides are there, who we are, what is this relatively new agency, because it was born in 2021, and what we are doing in the different sectors. So the agency is an executive agency, and I always like to present the first slide to make sure that the mandate of the agency is clear, because the Commission Services and the agencies are working hand in hand, but with different mandate. We are an executive agency, one of the 6 executive agencies of the EU spending programs, and we execute, we implement, we put in reality, in concrete projects, the policies, the different policies in different areas, and us in particular is digital and health, that are designed by the Commission Services. But we don't have only that role. We also feed back to the colleagues in the Commission Services the reality, what happens in the world outside, which allowed the Commission to have better policies, more impactful policies, by discussing with us how the participants are ready, how do they receive the call, and so on and forth. So as you can see, our role starts at the moment where the work program is adopted, work program for each specific program, which is done by the Commission services, but together with all the 27 member states. Once it's approved, there we start to work. Now, if you can go to the next slide. Voila. Just to give you a very quick overview of the different fields we operate. So we are responsible, as we said, for health, and I will say briefly which program, but not only, also for food. And you can see the link for food safety and health. It's very strong. And then we have a second strand, really responsible for digital, but not only research in digital, but also the implication on digital in health. That's why the two pillars were put together in this agency. And there is a part of Cluster 4 dealing also with the industry, research in industry and space. So it's quite a vast portfolio. Now, just one word I wanted to say. We were created, I mentioned before, in 2021. Why? Because it was the end of the pandemic, COVID-19, and we discover all in Europe the importance of working together for improving health, for being more reactive, and for being ready if something similar, hopefully not, to the pandemic of COVID-19 will happen again. So there was a need of having such an agency, which with a strong budget, but as you know, we can be impactful all nowadays, also if we applied innovation and digital technologies. So the digital transformation is now part of every policy practically in Europe, particularly in health, and we saw it again during COVID. So I always say we were creating during pandemic COVID-19, but not only during, because. So really, because of that, the Commission presidents, because it was a decision of Ursula von der Leyen, decided to put quite a big budget, which was 10 times more what it was before, in health. So now, just to give, don't go one by one, but when I said we work hands in hands with the Commission services, and I guess most of you would know these directors generals, our main Directorate General is DG Sante, but we implement programs of 6 parent DGs. DG Connect, of course, and we have here a colleague, representative of DG Connect, but also DG Grow for industry, for SMEs, for market, and DEFIS for the space part, RTD. You all know, you were mentioning before, it's called FP7, but it's a long story of research and innovation in Europe. And I mentioned as last one, HeDEA, because it's also a new authority, which was created even after, a few months after our agency, and is dealing exactly to make sure for preparedness and reactiveness of Europe in case of a pandemic, of crisis, health crisis. We work with all of them, when I mentioned before. Now, if you can turn the slide, please. Just for you to read the vision. It's our main vision. So HaDEA has been created for boosting Europe by building Earth to space, a healthy society, a digital economy, and a competitive industry. And all together in a synergetic way. And one of the sessions this afternoon, or even two, we will discuss about synergies. Synergies between digital and health, synergies in particular with the cancer aspects. So that's the reason why it seems at first glance, why so many different fields if you think of space industry, but in reality you will see, particularly in the specific presentation, le fil conducteur, why we are together, because by putting together the impact, also the economic, you have a better budget, more important, and the impact on the civil society, it is much evident, much stronger, because we want a healthier and more resilient Europe. Now, the programs we manage, I go to the part what we do, As I mentioned before, the two main pillars, you can see on the left-hand side, the main pillars of health, and I just mentioned the programs, which are health, the EU for health. It's not a new program, but before they have 700 million over 7 years, now around 5 billion over 7 years. So you see the importance also in budgetary terms that it gained. And that is accompanied in a synergetic way with the programs of research and innovation, the famous Cluster 1, dealing with health. Plus, we are also responsible for the mission on cancer. And the pillar is dealing together, as I mentioned before, with the part of the single market dealing with food safety. The other part, so the last three nice pictures, are again research and innovation for Cluster 4, which touches digital, industry, and space, but also programs of DigiConnect, Connecting Europe Facility, the CEF, and the DEP, Digital Europe Program. We don't implement the totality of these programs that I mentioned, but a great part of some part are implemented by other joint undertakings or directly by, if there is a policy implication, by the Commission services. Now, who are our beneficiaries? Again, many pictures. Well, first of all, it's not the agency deciding who are the beneficiaries, but it's said in the famous work program that I mentioned before, prepare together with member states, you define where the money for each year is spent, in what are the priorities, and who are the beneficiaries, because it depends on the nature of the programs. As you can see, it's very wide, the stakeholders community, and we can touch the research institutes. I mentioned before industry, SMEs, but also academia, and you know that, I guess, from the previous programs as well, international organization, but also national, local, and regional authorities, representative of the civil societies, and of course, NGOs. So you can see it's quite a wide range. Now, what we have done recently, very recently in HaDEA, because we believe we must really be efficient as much as possible, we have run a survey for the satisfaction, to check the satisfaction of beneficiaries, but also of unsuccessful applicants. Why do we do that? Because we want to boost our efficiency, to be more helpful, and to learn, because we learn from this. It's the only way we have to listen to you, to what is your impression working with us, both if you gain if you are a success beneficiary, but also if you fail or simply the budget was not enough to finance your project. And we were very happy of the result, I must say, because if you look, I mean, there it's divided by strength, very satisfactory, satisfactory, unsatisfactory. But globally, the satisfaction, putting together the satisfactory and the very satisfactory, concerning the part of beneficiaries, 84% is the percentage, which is pretty high. For the ones who were not successful, the unsuccessful beneficiaries is lower, is a bit less than 50%, still pretty high. Having said so, if you're not successful, you don't deal a lot with us because you just deal in the first part, the putting in the system the proposals. And then after the evaluation, you just receive a letter that you are unsuccessful. So it's also limited the experience with the agency. Now, with these results, because you fill in also why you were not satisfied or where we can improve, we are preparing an action plan internally to respond to the needs or to the gap, to the lack that we notice. And that's the first time, but we plan to do systematically, not every every year, but systematically. Next slide. Thank you. Now, once again, very quickly, what do we do with our money? It's not our money in reality, with the budget of the Commission. What do we do with that? we finance different kind of projects. And once again, we do not decide ourselves which are the projects that we finance, but it depends on the different programs. So, of course, there are research and innovation projects, long story, because we are now talking about Horizon 2020, but which is number 9, or the framework programs for research and innovation. So I would say the stakeholders are pretty used to this kind of programs because they have an older story. But we also, for example, create new IT software. We procure vaccines. We did, but recently, 2 years ago, 1.5 years ago, with the monkeypox. We were the agency buying all the monkeypox, then it was distributed to member states via public procurement in that case. We install Wi-Fi networks. Now there is a nice map I don't have in these slides, but in all Europe, you will see in the main cities, but also in the little villages, how many Wi-Fi have been installed with these programs financed by the Commission and implemented by us. But we also organize trainings and we also organize events. So it's quite spread, quite open, the natural project. Now, the project management life cycle, which is next slide. Yeah, thank you. We operate, probably you know, with 2 different kinds of procedures. The grant, which is a big majority, I would say the 90% concerning, even more, concerning research and innovation. It's a great majority. But U4Health, for example, has both grants, with the same structure of the grants that the research and innovation, but also lots of procurement. I just mentioned before the vaccines, but not only the vaccines. We have this procedure. Of course, it changes of the nature of what we want to do. Either we want to have a subvention, we say a grant, or we want to buy something, to buy a service or to buy a product. In that case, is a procurement. I don't go through all. It was just to show that we are responsible for the entire life of the procedure. So we are the ones publishing at the very beginning, both the call for proposals or the call for tenders. And then we follow all the cycle. When we receive ourselves in HaDEA, your proposals, we are responsible for the evaluation, where in most of the cases, in the great majority, we do the evaluation with the help of the external experts. And then we are preparing the contracts with the successful participants. We sign it, but our work doesn't stop there. We follow, that's why we did the survey. We help, we assist the beneficiaries all during the life of the projects or the tenders. And then afterwards, we also monitor what was the project, where it was done. We do it's a long process until the very end. And at the very end, what do? We feed back the Commission with the results, as I was mentioning, sorry, at the beginning of my speech, with feedback with what we found as a result in the projects. And it's very important for the Commission to know, for example, if a call failed, because the participants were not ready. So the Commission has the idea that that was a priority. We wanted to finance important budget, and then we discovered that the participants in member states were not ready. So it's good for the Commission to know also how to address the priority and the momentum. Maybe it was an excellent priority, but too early, for example. This kind of work is very important. And a nice camembert, as we call in French, of the budget. Now, I have a caveat. This budget we implement normally at the beginning of the mandate. The mandate is covering the MFF, which means for 21 until 27, which is the long-term budget of the European Commission. Supposed to be, I say supposed to be 20 billion for the totality of the 2 pillars. Now, it's very far away, so I don't know if you can read it, you can see, but all what is yellowish orange is everything concerning health, both research, framework program, or U4Health, or the food strand. Everything which is blue or light blue is concerning the other part, digital or industry or space, or the 2 projects of DG, the 2 programs of DG Connect, the CEF and the DEP. More or less it's balanced. It was more or less around 11 billion for health and 9 and something for the other part. Now, as you know, in the midterm, since it's a long budget, and the Commission 21-27, things are developing. There are new challenges in the world outside. So the Commission in the midterm of this financial period, they do a midterm evaluation, a midterm rethinking of the budget. You know, there was many challenges. I just mentioned one, the Ukraine war, for example. So there is a redefinition of the budget. And in some cases, we need to reinforce budget also to have more targeted, in a more targeted manner. So there is a redeployment of part of the budget. We are in the middle of that process. In February, the institutions met, the Council, the Parliament, they did an analysis of priority. And this budget will be lower, around 1 billion lower, more or less. But I can't give you exactly because now internally, so the decision has been to have a cut in the budget of these programs to implement. In particular, I'm referring to EU for Health and Horizon Europe, but to be redeployed for these priorities. Now, internally, there is currently discussion how the cut will take place, because, for example, Horizon Europe has many clusters, and we just deal with 2 clusters, cluster 1 and cluster 4, and not entirely. So they are discussing, the colleagues in the Commission services, exactly the repartition of this cut. So that coming back is valid nowadays, but you know they will go a bit lower, a bit more than 1 billion lower, I guess, but I can't be precise. Still an important budget, I would say, even if this, but life, you know, life is changing, so we have to change priority. Very quickly, I want to show you your country, how Greece is participating up to 2023. I don't mention 2024 because the evaluation is still ongoing of many, many calls. So I don't have the results. So it's very far away. I don't know if you can read there because it's very small, but I can tell you for the cluster 4, digital industry space altogether is around 185 million went to participants in Greece. You have on my back exactly the number per strand of participation and the equivalent budget. I give you the total around 185 millions out of the period 21-23. Going to DEP, we implement less budget in DEP. You have 28 projects and more than 12 million. And finally, for CEF, you have 4 projects for a participation of 16 million, which you can see just a sort of overview. But it's very good, but we are here in order to tell you all the possibilities, and you will see more after me. My colleagues will go more in details in the programs and, in the way of participating as well. And you will have occasion to ask all your questions, which is very important for the remaining part of. There are still many opportunities already ongoing this year and in the future. Going quickly to, where I can't see now, to the other part, which is the other strand, health, cluster 1. Oh, thank you. Because it's bigger and I need glasses. Cluster 1, including the cluster mission that I was mentioning to you, always for the same period, 21-23, we have 108 projects where Greece is participating, and a total of 114 million, a bit more than 114 million. For the program EU for Health, which is not research, is same period, 63 projects, almost 20 million. And finally, for the strand of food, it's a yearly, it's a contribution that we give yearly to support this, the member states in this field. And we have 8 programs per year for a total of 4.5 million. That's all. Just for health is not bad, because we are talking about 350 million euros contribution, EU contributions in this period. I concluded here my presentation by showing you all the key networks, and I want to spend a word to thank all the networks. This is depending on the programs, and you call national contact point for the research, national focal point for you for health. There are others important, and one is about to come. The CEF, I think, the DEP. The CEF is here. You can see, and the DEP contact point doesn't have a logo yet because it's about to come. But it's extremely important. And my message there, we really need to have a very active national contact point, because you are our voice in the country. We organize this Info-Day in Brussels quite frequently. We'll go to the country to organize Info-Day to explain what we're doing. But at the end, for the beneficiaries, it's extremely important the roles of this national contact point and national focal point, also because they know the national realities. That we far in Brussels, we have a general idea of all member states, but we don't know the national reality. So my really message is, please continue to contact us. We are at your disposal. We discuss a lot together, but be very active in your country, because you are, but we saw the difference in countries where national contact points are not so active. The participation goes extremely down. So that was my last message. And once again, many thanks for taking your time to listen to us. Thank you very much for this organization.
Okay. We would like to thank Ms. Zanchi for this overall... Okay. For this very holistic presentation, a view that we NCPs, we didn't have for Greece. So I think we learned a lot today, and I think the rest of the day and the workshop will have to learn much more things than that. So from the Ministry of Digital Governance point of view, we are focusing on digital decade. We all know, and you can see it in the next slide, that during the 2022, I don't know if it would be better to sit there.
Yeah.
So, okay. Practically we want to relate funding opportunities with policy. And I think one very important milestone was the proposal for the Digital Decade Policy Program and the compass and the relative targets that was issued in 2022. Practically all countries, and Greece of course, tried to aggregate all the efforts, all the tasks towards some targets. What were the targets was the commitment and how we will be able to achieve what is in the digital compass and what is in the digital decade. So practically under the supervision and the coordination of the Greek, of the Ministry of Digital Governance, the Greek National Strategic Roadmap was submitted to the European Commission. And now we monitor the implementation. So we have to handle the digital decade targets, KPIs. We also support a new instrument that came to the Digital Decade Policy Program, that is the multi-country project in the context of the European Digital Infrastructure Consortium. And of course, all this constitute our Greek National Strategic Plan. I will not say a lot because I think more of you are familiar already with the targets of the digital decade, about the skills, the ICT specialists, the basic digital skills, about infrastructures, connectivity, semiconductors, cloud sets, about digital transformation of business, for take up new technologies, cloud, AI, big data, innovators, late adopters, and all this stuff. And of course, the digitalization of public service that also Professor Anagnostopoulos explained the significant progress in the last period through interoperability and through GovGR. But this is, I'm not sure if this is the proper slide, but I will try to briefly describe it. So one thing is the policy, one thing is the target, one is the vision, the other is regulations. We have a lot of regulations that in Greece, and of course the Ministry of Digital Governance is responsible for, that we need to implement, that we need to implement at national level. And of course, the same issue comes also to the other member state. The difficult thing is here that, for instance, if we want to establish the single digital gateway we have to collaborate with other member states. We cannot do it on our own. The same happens when it comes to cybersecurity and the respective directive. The same happens when we discuss about the European data governance and how we are going to handle the Data Act. So all these things need somehow to be organized and jointly be solved. There are other things about interoperability. The new, some days ago, published the Interoperable Europe Act. We also have some days ago published the European Digital Identity Framework. So all these things, and of course the Act that we expect now to be published. So all these are challenges that we need to tackle, and are not only challenges, are obligation simultaneously for Greece and for other member states and for the Ministry of Digital Governance. I'm not sure if this is an exhaustive list of obligation or regulation, but I think these are the main points that the Ministry of Digital Governance is focusing, of course, and the health data space is also in this context. One big issue, we have a lot of projects, we have received a lot of funds, especially in the past, but there is a question mark, what happens when a project ends? And what is the sustainability of the solution? And here comes the answer, I don't know, we expect it to be seen. That is the EDIC, the European Digital Infrastructure Consortium, that practically have more lifetime than a project. So are the ones that involve member states, not only academia and research institutes, and try to do some things that could be useful and could be reused and provide solutions. So Greece is following very closely all these actions. And currently we have declared and we are actively participating in the ALTEDIC, the Alliance for Language Technologies, in the Europeum that's expected now to be published, the decision by European Commission for the blockchain. The impact EDIC that we are also chairing the working group, and we are very interested, it's focusing on the Interoperable Europe Act, and also we are chairing the European Cyber Skills Academy. So all of these put new requirements, new needs in terms of sustainability, in terms of the role of the EDICs, in terms of the projects that could altogether support all these actions. So one thing is sustainability, EDICs. The second is regulation and digital decade policy program. So what are we looking for? One thing is funding. Okay, you said, I think it was a very good explanation about that. The other is close collaboration with member states to find the appropriate member states. And in some cases, in some calls, there is a requirement that say at least 5, at least 3 member states to be involved, not one, not do it by your own. And because you cannot do it by your own at national level. Another challenge is the one that we are discussing here, and this is something that the Ministry of Digital Governance is focusing a lot, is to involve public administration bodies, not only research institutes, the authorities that have the competency to ensure sustainability. And of course, the close collaboration is needed because public sector always may not have the expertise required. So academic and research institutions are a very important asset for this, for that issue. And we also face a lot of issues when it comes to European programs, not HaDEA programs only, but other programs, for instance, NSRF and RRF. And of course, the National Investment Program, the Greek National Investment Program, because we have opportunities that need to be aligned, need to be avoid double funding, need to be complementary, and need to have similar common rules, especially when it comes to calls that say, okay, we support 50% of the budget, but you have to find the other 50% and all this stuff. And of course, here is a big question. What is the balance among expertise and competency in member states and in the calls and the proposals? For instance, in the context of the Greek ministry, we had a difficulty to join, for instance, the call for the national contact points. We have a difficulty to join the AI sandbox. And this is the question. okay, we may have or we may not have very much experience, but in the end of the day, we are the responsible to implement it. So how are we going to be involved? And here, what is the balance and how the calls and all of this should raise this issue, especially when it comes to the coordination support actions? I think it's a great challenge that we would like to discuss today with all of us and experiences. So we are deep diving in the depth. Of course, we focus on the depth, and we try to identify what could be useful towards the previous things that we said. We already have identified a lot of things, the testing facilities, for instance, in AI. Unfortunately, in Greece, we don't have testing and experimenting facilities up to now, but this is something that we need to see. The regulatory sandboxes, the language technologies, and we have a lot of funding about that. About open source foundation models for all this. Digital skills, there are interesting calls about the jobs and platforms for digital skills and for the data space for skills. Blockchain, of course, the European Digital Identity Trust ecosystem with the wallets and the next part. The calls related with interoperable Europe, and in connected public administration and GovTech, which is very important according to the regulations and according to the vision. And of course, the multi-country projects, so the sustainability of the edX. So I think this is our first initial, let's say, identification of opportunities, but we need to discuss with you how we can exploit them, one question, how we can contribute to the next DEP programs in the preparatory phase before comes this to the DEP committee as a proposal, I mean, for the years 25, 26, to see it and discuss how this could be jointly done. And of course, we expect from you other opportunities that we don't know, support that we do not know, and guidelines that we don't know. So this is from my Ministry of Digital Governance point of view, just to raise some issues for what we expect from today's event and the workshops afterwards. I think according to the agenda now, there is a coffee break. I don't know if we are on time. I would like to thank you all.
Welcome back from a coffee break. So, as Mr. Hogan introduced himself, thank you very much. We have the first presentation on our session on programs, calls, and synergies. Thank you very much for the participation. And we're looking forward to your presentation. Thank you very much.
So I will try to present to you the programs managed by the Health and Food Department. And namely, these are the programs in the center of these slides, the SMP Food Safety, the EU4Health program, and the Health Cluster of the Horizon Europe program. Marina Zanki, our director, has already explained the budget allocation and the DGs that we work with on a daily basis. And just to remind you how that works in practical terms, to simplify, the DGs, the European Commission, is in charge of preparing the programs. They develop the programs, usually in close dialogue with the member state representatives. And then once the programs are agreed, we take up the implementation for each of those programs. The Single Market Food Program supports human and animal and plant health by providing access to safe and high-quality food in the integrated single food market. Their goals are the prevention, control, and eradication of animal and plant diseases, to fight against antimicrobial resistance and its consequent impacts on human health, and also to improve animal welfare across the EU. In practical terms, this also means addressing the issue of food waste and the fight against fraud, sustainable and resilient food production, and effectiveness and reliability of the official controls along the food chain. And ultimately, this all contributes to the EU farm-to-fork targets. The SMP Food programs has fixed funding rates, which for most of its activities, around 50 to 75% of the costs. And in case of Greece, you benefit from a higher co-funding rate for most of the grants under this program, and that is 75% rather than the 50%. Some priority actions, in particular activities to third countries, so activities outside the EU, can be funded up to 100%. One of the lighthouse programs within this is the Better Training for Food Safety, BTSF. This initiative develops training strategy in the areas of food law, feed law, animal health, animal welfare rules, and plant health rules. And then coming back to what was presented amongst all the other programs, but if we focus on the food programs, this is the level of participation from Greece. We've already gone into that in the overall slides. The S&P food actions for this year will include grants to improve the measurement of food waste and implement food waste prevention for EU countries, targeting EU countries, but also specific stakeholders. And we will also be, through this program, supporting capacity building for the European Food Bank Federation. This also, the programs for this, actions for this year also will involve coordinating control plan for antimicrobial resistance, AMR for short, monitoring both commensal and zoonotic agents on samples of food and food-producing animals. We also have veterinary programs to support prevention, control, and eradication of animal diseases, and phytosanitary programs to support detection, containment, and eradication of plant diseases. And you'll find all our calls via this link, which is available through the slides. So all the calls are both on the HaDEA website, as well as the general funding and tenders website, which covers all funding activities of the European Commission and therefore of HaDEA. If we move up to the EU for Health program, the EU for Health represents a huge change in terms of the financial commitment. Again, it was referred to earlier, the increase of approximately tenfold compared to previous programs. And ultimately, the aim is to improve and foster health in Europe. And how to do that? The ultimate aim is also to protect people in the Union from the serious cross-border threats that we may be subject to make medicines more available and affordable across the EU, and also to strengthen the health systems, their resilience and their efficiencies. So we, in this program, base our work on annual work programs, which I mentioned are defined in close collaboration with the European Commission in the lead. And this can involve, this then leads to a number of activities, funding projects through both direct grants, open grants, and operating grants, depending on the type of action and the stakeholders involved. Also involves the purchase of services, through the procurement programs, for studies, for vaccines, for organizational support, for training, for logistics, and we can give some examples of that later on. Our agency also liaises with the national focal points for the EU for Health program, and these are the representatives across the national, usually the health ministries across the EU. And finally, we at the agency also manage the legacy programs. So the projects that are still ongoing from the previous programs, whether it be the health program, the third health program of DG Santé, or the Horizon Europe projects, the Horizon 2020 projects of the previous framework program. But we will come back to that later. So the big differences between our procurement programs and our grants programs for EU for Health, they have different modalities. Some of them you can see there, the principles are different, profit versus non-profit for grants. The payment, which is either an agreed price for procurement or based on approved cost for grants. The legal form is different, a contract versus a grant agreement. The procedures, of course, call for tenders versus calls for proposals. The purpose is to buy in the case of procurement and to give money for grants to advance progress in the case of the grants. And finally, and importantly, the ownership of the goods and services becomes the property of the contracting authority in case procurement, and remains in the ownership of the beneficiary in the case of grants. Again, here we have the funding rates, which vary across the different types of actions. So for the actions and operating grants, it's up to 60% of eligible costs that are co-financed, unless specified otherwise. There can always be exceptions, for instance, for the exceptional utility clause, which can be 80% or even 100% of eligible costs. And we also have specific grants for some international organizations like WHO, where the rate is up to 100%. And in all cases, the indirect costs are included via a flat rate, which is 7% in the case of the direct eligible costs. Here again, the snapshot of the Greek participation in the EU for Health programs. And here we also, in addition to the information we provided earlier, where we have the overall number of grants, so we have 63 grants involving Greece out of a total of 290 grants awarded so far through the program. And here you also have the figures of what that meant in total grants awarded. But we also have the third health program legacy, so the projects from the previous program. And you can see that there, partly the participation was lower in proportional terms, where we had a similar number of grants signed at the end of the program. This is the 7-year program, of course, with a much lower budget. So the grants were probably smaller, and the Greek participation was actually overall much lower than it is now. So I think that seems a very encouraging signal if we consider that we're not even halfway through the current programming. The annual work program for 2024. So what's on the table today? Well, we have the full annual work program is available online. And so we encourage you to examine the topics and the tentative calls, which have been published also via the HaDEA website or the funding and tenders portal. And we also invite member states, if they haven't done so, to nominate the competent authorities for joint actions and direct grants. And likewise, you will find the indicative timelines for procurement through these documents. I won't read through all these upcoming calls, but it gives you an overview of everything that's on the program for 2024 so far. And of course, if we look at the bigger amounts, there's a major investment in continued support to existing wastewater activities, including the establishment of an EU Sentinel system for surveillance, and the support to speed up the development of access and uptake of medical countermeasures, including critical medicines, and that is in support of the HERA activities. And if I move to a second slide, on this, again, you can read through these quickly, but if we stop on some of the headlines, the organizational support to member states to implement the new regulation on substance of human origin will benefit from a significant investment, over 5 million. And likewise, there's 4.5 million dedicated to support center for European electronic health record exchange format. And for the interoperability and security of the electronic health record systems. So you can see from these actions, the span of activities is quite wide, and the support. And if we just to finish with what was mentioned earlier, antimicrobials, there's a very significant investment of 50 million dedicated to support innovation, supply capacity, and access to critical medicines and antimicrobials, again in support of the HERA objectives. And I mentioned that we would give some examples of the procurement activities. Marina also mentioned the monkeypox action, where at the very beginning of 2023, in fact, through activities that were managed very quickly by the agency, at the end of 2022, we organized the purchase of over 330,000 doses of monkeypox for emergency delivery to a number of EU countries to contain this potential epidemic. And likewise, the agency has procured access to, and is continuing to procure access to, manufacturing capacity for vaccines, securing the capacity to produce over 325 million doses of vaccines using various technologies. So to have the possibility to react to different circumstances. And these just are the most recent specific contracts that are included in the 2024 work program, which is currently under preparation. Now I'd like to move to the Horizon Europe Health Cluster. And the objective here is research. So it's to generate new knowledge and develop innovative solutions to protect people's health and well-being. And in practice, we hope that this will help promote social cohesion, inclusiveness, and the health and well-being of Europeans, but also people across the world. By making innovative, high-quality health technologies and healthcare available and affordable, and also to make healthcare systems more accessible, sustainable, and digital. How we engage with this? Well, ultimately, we fund projects. So we, as mentioned earlier, we organize the calls for proposals, and ultimately, with the help of external experts, select the most promising projects, and we monitor them during their lifespan, which can be anything from 2 to 6 or 7 years. We work closely with the national contact points to help disseminate information. And I'm glad to see that they're here in numbers today, covering all the programs. And finally, as mentioned for the Youth for Health program and the third health program of DG Santé, we also manage the legacy of Horizon 2020. And for instance, for the health cluster, we still have 300 projects ongoing from Horizon 2020. And this is the project management lifecycle, which I just alluded to, the call for proposals. So more in response to the calls, applicants submit proposals. We evaluate these proposals with external experts. And this is always also, for me, an opportunity to call you out to potentially be an expert if you are not already an expert for the EU. We strongly rely on the peer review mechanisms to assess these proposals. So we are always looking for expertise from all over Europe and beyond to help us select the best projects. So once we have our short lists of projects for funding, we prepare the grant agreements, which is a mixture of fine-tuning of the project, but also of putting in place all the administrative and financial measures. And then we monitor the projects during their duration, and we also support the project in its dissemination activities. Just for an indication, in the health cluster, we now have, from the first 3 years of Horizon Europe, we have close to 400 projects now ongoing. These are the funding rates for grants. So for grants, as you see that the European Commission tends to be slightly more generous. So it's usually 100% of the cost. For research innovation actions, for coordination support actions, and for pre-commercial procurement actions, but slightly less for the innovation actions with 70%, although for non-profit organization, it remains at 100%, and likewise for the public procurement of innovative solutions, PPIs for short, where it is only up to 50%. The vast majority of our funding goes through the research and innovation actions, just to be explicit on that. And again, there's also a measure to cover indirect costs with a flat rate of 25% of the direct eligible costs, which is intended to simplify the whole process of reimbursing indirect costs. And again, the snapshot of the Greek participation in Horizon Europe, it was already mentioned, 238 participations in 108 projects out of almost 400. So that's quite a very strong participation, I would say, and also a significant amount of total funding from these participations. And again, if we compare to the previous program, throughout the 7 years of Horizon 2020, the contribution was, the overall contribution was 105 million out of 4.3 billion, whereas already in Horizon Europe, we're at close to 115 million out of the 3.1 billion so far disbursed through the first 3 years. So I think these are encouraging figures. And just to finish on that, a message about the coordination of projects. As you can see in the participation from Greece, we have 25 as coordinators. This is very important. It's the real leadership of the projects. It's quite demanding, but it's also, I think, quite rewarding in terms of the influence you can have on the project. And also, as you'll see in a couple of examples, leading a project tends to, the coordinators tend to bring along a few other partners from within the same country. So that has a kind of a snowball effect. Here are just a couple of examples. I won't go into the detail, but just these are projects led by Greek organizations in Horizon 2020, projects which are still ongoing. And you can see, well, both the diversity of the projects, but also the other entities that are brought along amongst the participants. And also in this case of the second project, it also reminds you that you can have participants from outside the EU. In fact, in the second project here, DigiCare4You, there are Australians and US participants, and that's always a reminder that our program is very open to international participation, whether it's in cluster 1 or cluster 4 or any other cluster, with a few exceptions. And now a couple of examples from Horizon Europe. So these are projects which are more recently started, but again, you can see that the Greek leadership has brought along other Greek participants in the projects. Even in the case of the second one, it's a very big project with 40 participants. And also gives you, again, an indication of the diversity of the projects. And maybe we're getting hopefully close to the end, a few of the basic principles of funding collaborative research. And again, this is equally applicable to other clusters, but I think particularly for the collaborative research part of the framework program, the annual programs are published or updated each year. The funding rate, as mentioned, tends to be 100% for most actions. There are research innovation actions. There are minimum levels of participation, which I'm sure you're familiar with. Partners from third countries can be included. And there are in many cases where they can get funding, but not in the case of industrialized countries. Even though in some cases there can be exceptions to that if the partner is just to be essential to the project. We conduct the application process in either a single stage or a two-stage process. The single stage being a very short proposal with only 2 criteria examined. And as I mentioned, the process for examination is the peer review along 3 criteria with a minimum of 3 experts per proposal and occasionally 4 or 5, depending on the complexity of the topic and project. We have ethics screening for every shortlisted proposal, and we have obligations to sign the grant agreements within a reasonable time, and that's deemed to be 8 months from the time of application. And of course, with the funding comes some duties of reporting, both on the scientific progress and on the financial aspects, usually every 18 months, occasionally every 12 months. And just to tell you what's going on this year for the health cluster, well, we are for most of our calls, the calls are closed, and we are currently in the midst of evaluation. In fact, the individual assessment by experts of all these proposals started yesterday, and we hope to complete the whole process and issue the results by 19th of July. However, in April, the Commission updated the work program for 2024 and added three new topics for a total indicative budget of 85 million euros. And you can see some significant new actions foreseen to address pandemic preparedness, to address implementation research for multiple long-term conditions in the context of non-communicable diseases, and finally, a pre-commercial procurement action for environmentally sustainable, climate neutral, and circular healthcare systems. And the closing dates, the closing deadlines for all these 3 topics is in November on the 26th. So still opportunities for funding this year. We also issued the 2024 call for the cancer mission. This sometimes comes a little bit later than the main calls. And as you can see, the total budget for this year is 119 million euros. I won't read out the 6 topics, but of course, all that information is available, and the deadline is September 18th. And we have some information days for both of these programs. The Cluster 1 update, it's the second one, is on the 28th of May. And that will just focus on these 3 new topics. And for the missions, there will be a 2-day event covering all 5 missions. And I think in the case of the cancer mission, it's on the second day, on the 26th of April. We have a number of tips for grants that I think I will not read out. But for grants and for procurement, we have these in the slides for you. Some of it seems very evident, but you might be surprised that some evident things are sometimes missed out by applicants, and early mistakes can be avoided by paying attention to this. But I think much of this is sometimes better said by national contact points, so I want to leave plenty of them to say and advise on. And I think this is applicable to all the programs, but not just the Cluster 1 Horizon Europe program, but also EU for Health. This applies to all grants. And for procurement, we also have some advice for those of you applying for the tenders. And again, of course, the key and most important thing, the most important aspect is to have the information as soon as possible and to read very carefully all the terms and conditions of these processes. So thank you very much for your attention. As I said, there are calls for proposals, there are calls for tenders, but you can also become an expert. This also is an opportunity to gain experience of how to prepare a good proposal, what makes the best proposal succeed and what makes good proposals not quite make it. So I think it's also beyond the service that you would provide as an expert to the process, and which is we're very grateful for. It's also a learning opportunity, a networking opportunity, and one which most experts usually are happy to repeat. So I think that is the end this time. Thank you.
Thank you very much for a very informative, interesting and detailed presentation. I think we have seen a wide span of activities and the issues that this calls address. So if there are any questions or issues to be discussed, please go ahead and ask your questions. I would like to ask, is there any help for anybody who wants to submit a proposal, both on how to write a good proposal or to find any partners?
Yes, our usual reflex for that is to direct you to the national contact points. No, but there's plenty of information on how to and opportunities to find partners. There's also a number of workshops, which some of them are recorded, on the basics of putting together a good proposal. I think the Commission usually puts out some of these at the very beginning of the framework program, but also, and I think our colleagues, national contact points, will probably say more about this. There's usually a lot that happens at national level to help that. The national contact points also play roles in helping finding partners. They are usually very well networked. I know this is very much the case for the health cluster because we work with them, obviously, and they go to a lot of trouble to try to help people find partners, or whether it is trying to fit it into a consortium or a consortium trying to find specific expertise.
Okay, thanks. So there are programs and they have a long history, like programs we have for health, but there are new programs like Digital Europe. It's a bit more difficult. It's also a bit more difficult to understand a program like this. We will come to it now and in the afternoon, but there is a lot of information in the founding and tenders portal of the European Commission, and through that I think there are links to specific sites of the European Commission directorates and executive agencies with a lot of information. We can find a lot of information because there are a lot of guidance notes there on on the specific features of each program. So, in addition to what Stephen said.
Thank you very much. So if there's not any other question, shall we proceed?
Okay, assuming it is for Digital Europe, since we speak about a lot of digital here. So we are working on the work program 25-27. Already there is a timeline present to the program committee. It's not public, but we can certainly say that the first call for proposals for work program 25 for Digital Europe will be published on Q1. It means the first month. And you can imagine it will not be exactly January. So, voila, first indication. And for more precise timeline, you can contact program committee representatives. But I give you the information here. Thanks.
Okay, thank you very much.
I can add that for the framework for the Horizon Europe, Cluster 1 and 4, it will be similar. First quarter of 2025, but probably the latter part of the quarter and with some uncertainty. So it's too early to say, in short.
I suppose it depends on the call, but the experts here are going to tell you.
Well, again, I'll start with the Horizon Europe programs. Absolutely possible and encouraged. And in fact, there's many programs will benefit from the having the collaboration of academia and industry. It's possible for small companies to apply. It's possible for companies to lead projects. That's what I can say for Horizon Europe. I won't delve into the other programs.
So we'll move to the next presentation by Ms. Kathleen Engelbosch, if I pronounce it correctly, who is head of the Department for Digital Industry and Space in HaDEA. Thank you very much.
Thank you very much. Good morning, colleagues present here, but also good morning to all the many people present online. So my name is Kathleen Engelbosch. I'm head of department of the second operational department of HaDEA. So we have in HaDEA three direct departments, 2 operational departments, one for health, one for digital industry and space. And then there is also a horizontal department dealing with legal, personnel, and administrative matters. So this is how my department looks like, at least with regard to the managers. So it's a department with about 150 staff members. We have 4 units and about 18 managers, if we take into account head of units, deputy head of units, and then head of sectors. And each of these units are dealing with the implementation of one or the other program that I will come to in a second. So the programs that we manage in Department B are, so we have, first of all, 4 what we call parent DGs. Actually, should call them partner DGs, but the formal name is parent DGs. So it means that we implement programs that are designed by these commission services, and this is DG RTD, Connect, Grow, and Defis. So we have 3 programs under the current MFF. First of all, Horizon Europe Cluster 4 is the one that you're most familiar with, probably. Then we have CEF Digital, and then we have the Digital Europe program, a new program. All in all, the budget is close to 9 million being managed in my department, and this is for the period 21-27. So for Cluster 4 has a budget of 15.3 out of the 95.5 global budget for Horizon Europe. We don't implement all of Cluster 4. We implement 6.1 billion, and the rest is being done by joint undertaking HPC, by EUSPA, the space agency in Prague, and then also by ESA. The CEF Digital, we implement 1.6 billion out of 2 billion. So also there we do the majority, but other parts are being done by other bodies. And then the Digital Europe program, we implement 0.8 billion out of 7.6. So it's a relatively tiny part. The rest is being done by DG Connect, joint undertakings, also the European Cybersecurity Center that was newly established in Bucharest. we're really part of the whole equation of others. And then we have the legacy projects, Horizon 2020, Wi-Fi for EU, CEF Telecom. I'll come back to this project in a minute. So I start with the CEF digital program. So CEF is standing for Connecting Your Facility. So the whole objective of this program is to provide an EU-wide digital connectivity infrastructure that is secure, that is robust, that is capable of handling a high capacity of data. So this is not a research program, this is not an innovation program, this is really purely deployment of infrastructure. And I mean, you can have as many nice digital services that you like. If you do not have a proper, robust infrastructure, then actually you're nowhere. And in answer to one of the questions, I mean, can everyone participate here? It is much more restricted because these are relatively important strategic projects where the member states also are to a certain extent involved. So we have special features there that you do not have in Horizon Europe. For example, we ask for security declarations of the participating entities. So each of the entities that participate need to give a declaration that they're fully compliant with the national, European, regional rules regarding security, regarding cybersecurity. We also do security scrutiny because we need to identify in advance whether some of these projects are so sensitive and maybe could give rise to some classified information. So that is something that we need to know in advance. And we also do what we call an OCA assessment, a foreign control assessment. It means that for the majority of the topics, not all of them, we need to make sure that we are dealing with entities that are EU controlled. So we actually do a careful assessment, which is being done by another executive agency, HaDEA, and we really are looking into details. Who are the shareholders? Who are their subcontractors? Who are the suppliers? Who are the suppliers of the suppliers? So we really need to make sure that we deal with EU-controlled entities, and this for security reasons because of the strategic importance of these projects. So just for your information, for those who are interested in this, we have currently a public consultation open. I mean, the European Commission, DG Connect, until the 30th of June. And the title is, and this is after the publication of a white paper, How to Master Europe's Digital Infrastructure Needs. So if you are interested in this, you can read the white paper, recommendations, and then participate in the consultation. So there are three main areas in this program, 5G, then the backbones, and then coordination and support actions. So the 5G, this is about 5G for transport corridors, for example. So what are transport corridors? These are cross-border areas whereby we want to ensure that there is uninterrupted 5G connectivity, mainly for road transport, but also rail and maritime transport. Then we have the 5G computing for smart communities. We finance here smart communities, local projects very often in one member state, whereby we actually have use cases and see how can we set up a 5G community in the areas of health, in the areas of education, public services, etc. So then we have the backbones, and most of the money, 50% actually, is going to the backbones. And if you think about backbones, we actually think about the digital global gateways. And if we talk about digital global gateways, we actually concretely mean the submarine cables. It's not only that, it's also, for example, terrestrial infrastructure for satellites, but the majority is really the digital global gateways, the submarine cables. Now, 99% of international internet traffic is going over submarine cables. We usually don't know about it. We are usually not aware about it. It's only when we hear about the cable being broken in the Red Sea that we actually say, oh yes, okay, there is this. Quantum communication infrastructure, it's mentioned here. We didn't have a call yet on this topic, but there will be the first one in this year, which will be a 90 million call, again, terrestrial infrastructure for quantum. And then we have coordination and support actions, the operational digital platforms. These are platforms that actually serve as a kind of data hub, if you like, for the 3 strands of digital, because for the 3 strands of CEF, I mean, so the CEF program has 3 strands. There is digital that we're implementing. Then there's also energy, and there's also transport, which is being implemented by others. So this is just a snapshot of what we're doing in this program. These projects are close to the market, so the funding rates are completely different than you see in Horizon Europe. The default funding rate is 30%, but if it's cross-border, it's 50%. However, if it is, if there are also some social economic elements involved, then it can go up to 75%. So it's completely different. Here you see the map for the 5G transport corridors, both for call 1 and 2. We're currently evaluating call 3 for CEF Digital, so I cannot at this stage make any big announcements. So this is how the map looks for the 5G transport corridors. This is how it looks for the 5G smart communities. And voila, so both the first and the second call. And now I should have a map. Yes, with the digital global gateways. And you see that this is absolutely not limited to Europe. We actually are there connecting with the rest of the world, the Caribbean, the Nordic countries, the Atlantic, the Baltic Sea. So this is really going very far. And you may ask yourself the question whether, yeah, this is the call 2. So you see here the complete map. So CEF Digital in Greece, I don't know how many of you are aware about the involvement of Greece in the CEF digital program, but we have actually a number of Greek coordinators involved in project. We have, first of all, the 5G Seagull project in the 5G for transport corridors. And these are cross-border corridors along the Greek-Bulgarian highway. We hereby assure in uninterrupted 5G connectivity. It's about 300 kilometers on the highways in Greece and about 173 in Bulgaria. With a Greek coordinator. And the idea is that we have uninterrupted voice calls, uninterrupted video calls, traffic sharing, data sharing, transport safety. So this is what this project is about, which is ongoing. Then in the area of the 5G and smart communities, we have a project 5G Terra, also with a Greek coordinator. And this is about 5G infrastructure for the public interest and for social inclusion. That's why it's 75% funding in this particular case. And this is mainly to give 5G to people in rural or sparsely populated areas in Greece. And then also for the digital global gateways, we have 2 projects in Greece. First of all, there is the ATMET East DG, which is a submarine cable fiber connecting Greece, Cyprus to Italy and the Mediterranean data gateway. Then there's C-Spine. We here built a new submarine optical fiber links between 11 Greek islands. And because this is really within Greek, the financing is 30% in this particular case. So as I said, we have currently an evaluation ongoing for the 223 calls. You see the timelines here. So we have just finalized the external evaluation, and what we have also differently than for Horizon Europe, after we finalize an external evaluation with external experts, we then actually have an internal evaluation, which is being done by the Commission services. And we are about to start this internal evaluation, and it is by October that we will actually have the Commission award decision. And you see here the budget for this call. So this is ongoing. Now, I cannot talk about connectivity without mentioning the Wi-Fi for EU project. Maybe EU, if you walk into the streets somewhere in your village, in your city, you actually see a kind of logo, the logo that you see here, Wi-Fi for EU. And it was the previous Commission President, President Juncker, who in the State of the Union said, I want free Wi-Fi for every European citizen. That's it. So DG Connect start working. And the result, what happened following this is that the Commission, DG Connect, worked out a kind of voucher scheme whereby we had 4 calls, and we had about 10% of the European municipalities that actually received such a voucher of 15,000 that they can give then to a company in order to set up hotspots, free Wi-Fi for you in public spaces, touristical places, hospitals, libraries, etc. So this is the result. And I asked my colleagues to, okay, I'll try to do this maybe here. I asked my colleagues to give me the map for Greece. And so you see that you're actually very successful. 94% of Greek municipalities have granted such a voucher. And you also see here the areas where you see these hotspots with about 500,000 as an average end users on a monthly basis. So all over Greek, you know, maybe next time you pay attention, you see this logo and you can have free internet. So Digital Europe, I'm not going to talk in details about Digital Europe because my colleague Elizabeth will do this. It's a new program. It's also not a research and innovation program. It's all about deployment. And I mean, this is really Europe saying, you know, we need to do something, you know, to catch up with the rest of the world. You see that China, the US only, or for example, investing 20 billion a year only in AI, we're actually absolutely nowhere. You see the 5 pillars. I'm going to skip this because I understand, Elizabeth, you will be speaking about this. And Elizabeth will also explain that HaDEA will only deal with a minor part of this. So this is the objectives, which I understand, Elizabeth, you will also cover. Yeah. Good. Then, so I then arrived at the Horizon Europe part, the cluster 4 that is being implemented in my department. And under pillar 2, we have the digital space and industry part. The vision of cluster 4, I mean, it's all about the green and digital twin transition. And it's all about an ethical human-centered approach of digital and industrial technologies. You can see that if you read regulation, if you look at communications of the Commission, this ethical human-centric approach is really coming back again and again and again. We heard about it also if you look at the compass, the digital compass. You have it in the DAB, you have it in the AI Act, the persons at the center, a robust, trustworthy digital services. So it's something that is coming back again and again, and that we also see in cluster 4 in the vision. So we have 6 destinations, what we call destinations in cluster 4. We have some of them in common between digital and industry. That's why we have also joint calls in this particular area. Destination 5 is for space, for example, so strategic autonomy in developing, deploying, and using global space-based infrastructure, services, application, and data. In the other destinations, you see neutral data, human-centered approach. So this is what we're dealing with in cluster 4. I have here some figures for Horizon Europe Digital. We have calls this year for nearly 200 billion. So you see here the destinations that the digital part is dealing with. Currently, we have not yet, but close to 600 million projects in the digital area. And we then also have the legacy projects, meaning the projects from the previous programs that are not yet fully implemented. And we still have about 91 projects ongoing for more than $500 million. Then for industry, which is the biggest part also in terms of money, we have in the industry unit 3 sectors, the raw material sector, advanced materials, and then a sector for sustainable products. Also here you see the destinations. I'm not going to read them out. And then we have the legacy, for example, the NMBP program, nanotechnologies, advanced materials, biotechnologies, advanced manufactories. These are also a part of the legacy that we're dealing with. Then space. Space also has a relatively small budget, and it's also a little bit special within Horizon Europe in the sense that also there we have security screening, also there we have foreign control assessment. We also have sometimes classified deliverables there because of the involvement also of the member states, also because these are strategically important projects. And we work in a triangle. You have the EU SPA, which is the European Union Agency for Space programs, and we have this in Bucharest, in Prague, sorry. Then there is the ESA, not a European institution, the European Space Agency, intergovernmental, and then you have the FIS and you have HaDEA as an implementing body for this. So we really work a lot together within this kind of international setting, if you like. With or intergovernmental setting with the EUSPA and the ESA, and I here so on this slide give you some figures of what is going on, and so we also have here not only competitive calls open for everyone who actually fits within meets the conditions, but we also have here identified beneficiaries mainly in the what you call the STT, the surveillance and tracking of space in order to make sure that we manage the debris in space. This is an overview of the Greek participation, and I mean, all in all, you've also already seen some figures, so you're absolutely not doing bad at all. Just look at, for example, the digital part of Cluster 4. We have 64 participants in 57 projects out of 111. So that is really, quite a lot. The same in industry, quite a good presentation. Even in space, I would say, in Digital Europe and CEF Digital, it's to a lesser extent, but all in all, I mean, Greece is doing a very good job in all of the programs being managed. I don't think I need to talk a lot about the digital decades that was this was a Council and European Parliament decision of 22. Which is really the Commission saying now let's really see what we really need to do in order to arrive by 2030 at a real digital single market accessible to all, and a market that is also ready for the next generation of services. So the values are coming back. You've heard this morning Dr. Stasis talking about how Greece is doing for each of these targets. I just put up this slide because it shows how important HaDEA is, what role that HaDEA is playing there with the implementation of the Digital Europe program, Horizon Europe, and with the CEF project. So we really, together with, of course, the Commission, the parent DGs, we're largely contributing to this very wide effort, which really involves also the member states to a great extent. So then I want to say something about synergies. Now, I'm sure that if you are in a workshop or you are wherever participating, that you talk about synergies. Oh yeah, we have to do something about synergies. For a long time in the European Commission, we talked about simplification. You know, we need to simplify. Our stakeholders want to cut red tape. We think we have come already a long way on this, and now we talk about synergies. Now, are we there yet? You know, sometimes some people tell me, where is the website of the Commission where I find in a very clear manner in one page what is synergies and how do I do it? I mean, no, we're not yet there. I mean, but we're absolutely working on it, and we really have been making progress. And I mean, synergies, it's very clear what it is about. If you work together in joint actions, in coordinated actions, then you simply actually can have a better result, you can have a better impact. So the advantages are clear. You can use resources in a more efficient manner. The impact will be bigger. You can very quickly scale up some projects. You really reach more stakeholders. You can avoid overlapping. You can avoid duplications, and you can better really deal with these economic challenges. So I need to talk about a press release of the ECA, the European Court of Auditors, in 22, because they looked at synergies between Horizon Europe and the cohesion funds, more in particular the structural and investment funds. And the audit actually was very negative for the Commission. They said there is a substantial lack of coordination. You're really like chicken without head, walking around in your corridor, just thinking about your own rules, your own stakeholders. You're really not doing anything seriously with regard to complementarity, coordination with other funding instruments. So they're not used in a complementary manner. It keeps really the R&I divide ready. You cannot maximize the impact. You have different rules. They're not aligned. Yet timelines are not aligned. If there is cooperation between the member states and the Commission, it's patchy. It's by accident, by error more. It's not really something that is really planned. And you have actually no mapping. You don't have any database, which is really giving a robust picture of actually how we are working together with the other funding programs. So it's really a missed opportunity, and please do something about it, because we're going to look at this in the future. So that's why I think in the meantime, lots of things have been done. If you're interested in reading some background documents, then you can read the RTD action plan. This is an action plan with 15 concrete actions in 5 particular areas. And the dialogue with the member states obviously is a very important part of this. There is also a Commission notice on synergies between the EDRF and Horizon Europe, with lots of examples, you know, how can you reach synergies? And recently in February, there was also under the Belgian presidency, a big conference with the focus on synergies between the DAB and Horizon Europe. So it's something that we're also very closely monitoring now while we are in the course of doing the ex post, no, not ex post, the midterm evaluation of Horizon Europe. So it's also something that we're looking at. So we make a distinction between synergies by design and synergies by implementation. So synergies by design, the Commission is in the lead, because we know that the Commission services, they design the policies, and they are really more and more making sure that there are cross-references when they draft programs or work programs. They make sure that there is a legal basis, that it is, if not a very strong legal obligation, at least a soft obligation to do something about it. They try to align strategic priorities. They try to see where are the complementarities, you know, where can we avoid duplications. And there is now in place a very strong inter-service network within the Commission, where also HaDEA is participating in order to make sure that we talk a lot with each other, that we talk a lot with the member states. So synergies by implementation, that is really internal workshops that we had also within HaDEA. We also have been inviting sometimes companies or consortia of different projects in order to cluster them, in order to bring them together, to let them talk one to another. So in the implementation phase, we are doing a lot. And I'm really convinced that in the next MFF, the next multi-annual framework, financial framework program, we will see much more of this. I think this will come out stronger, because we're really looking backwards and really taking lessons learned. And so we can have several categories of synergies. We talk about complementary funding, whereby we bring together funding from different programs. An example is, for example, the digital innovation hubs. They're financed for 50% by the DAB, and 50% is being paid by very often national funds, but it can be also by cohesion funds. Sequential funding mean that you can imagine that you have, for example, in Horizon Europe, a project with a low TRL and you actually go up a level to a higher TRL, or you go to the deployment phase in the DEB program. Then alternative funding, if we think about alternative funding, then we think about the seal of excellence. All the projects that we have in the CEF digital program that arrive on a reserve list, we give them not those that actually are on a reserve list that are good projects above a certain threshold, but that we cannot finance because we don't have the budget. We give them the seal of excellence. And what it means is that they have a label that they can then take with them to look for other funding instruments. It means that they do not need to undergo yet another evaluation. They have been evaluated, and this evaluation in, for example, in CEF is being taken into consideration. They, of course, need to meet the conditions for the program. And then we have complementarity of parallel projects, whereby we really look, for example, in the areas of skills. We have been talking, we HaDEA with DG Connect, but also with DG EHR, also with DG Employment, to say, okay, what are you doing in the area of skills? How can we make sure that we do not have overlapping calls, that we need to make sure that we each really concentrate on our specific features of our specific programs, and that we avoid overlapping. Because what we do want to avoid, what we did have sometimes, is that people with the same project are betting on several horses. They just submit the same project in several programs, and then at the end of the day, they take the one that that gives the highest budget, which we all understand, which is normal. So, I mean, for synergies, what we do not mean by synergies is how can we make sure that you have the most money as possible. I mean, that's not the purpose of it. The whole idea is how can we actually maximize the impact by talking to each other and by working together. So synergies across the HaDEA programs, you see that we have now legal basis in each of the programs. I just mentioned some of them, where actually there is a reference to synergies, and the NCPs here in the room know that it's also an obligation to strive for synergies with other programs. So synergies with health is just, I'm not going to read out this slide, but in HaDEA, if you ask any unit in any program who is dealing with health, then also in my department, everyone will raise his hand and says, oh yeah, it's me. Even the space unit, they're dealing with, at the end of the day, space services for health purposes. You find it really in each of our units. So this is really, where are the synergies between the digital and health? Then, yes, this slide is interesting. It's a slide that I took from the RTD, because, I mean, Horizon Europe, of course, it's lots of money, 95.5 billion. But if you look at the other funding instruments that are there, then actually you see that most of the money is somewhere else. I mean, if you look at the recovery and facility faculty, for example, this is worth about 338 billion in grants. If you look at the European, the social fund, 99.3 billion. So if you look at, for example, the cohesion funds, it's about 392 billion, of which 226 billion only for the European Regional Development and Cohesion Fund. So there is lots of money there to get. I mean, it's not, please look a little bit beyond Horizon Europe. I know that when you have projects in Horizon Europe and you're financed for 100%, you do not necessarily think about it. It's more for the deployment programs whereby they actually look for the matching funds. But there is lots of money to get out there. And then we also heard this morning that also you have, of course, the national funding. This is how the slide looks like when we talk about potential synergies between Digital Europe and other programs. For your information, this afternoon, there is another session with my colleague Jean-François Junger and Elisabeth Lepiatou. They will more in details talk about participation rules, fundings, and also synergies in these specific programs. This is just an example of a synergy project, synergy between H2020 and the DEB program. So we had in 22 a number of projects, about 8 to 10 projects. They developed innovative analytical tools to support European law enforcement agencies to enhance investigative and forensic capabilities. And they looked at image and video text and data acquisition. Now the Empower project, which is a project under the DEP program, is actually building into this. They looked at under this project in H2020, and they really said, okay, we are here at TRL 6, let's try to bring this to TRL 8, and let's actually see how we can use them and how we can actually make sure that all these requirements that we ask for AI-based solutions, that they really apply here, that they're trustworthy, that people are at the center, that they're robust, that they're transparent, that they're reliable, etc. So this is just an example of a synergy, and you see the impact of this is quite big if you really combine them. This is another example from the area of health, so tackling rare and complex diseases through the European reference networks. They were established, these ERNs were established under the third health program, but now they continue under the EU for Health program, and it's actually the CEF program that is helping with already the CEF Telecom program, so the predecessor of CEF Digital, so CEF Telecom, that was helping with the infrastructure, but also with the training. So this is a network whereby lots of information, lots of data is traveling throughout Europe with healthcare providers. And the impact and the positive result is that it's actually not the patients that who's traveling, but it's actually the data traveling. And therefore you can, accelerate diagnosis and improve treatments. I have a few other examples, but I think time is running out. So we can give you a copy of the slides where you see that we actually are built further on projects that were developed under one program, like here, the FACS EU Joint Group. We have H2020, we have the third health program, we have EU for Health. So the synergies between the digital skills and looking for complementarity, I already talked about this. So I think I can skip these. This is what I said, that in CEF Digital, the projects that arrive on a reserve list and that are good that we couldn't fund because of lack of budget, they get the seal of excellence. And with this, they can then look for funding somewhere else. So if you want to read more, there is a commission on synergies. There is a commission notice of 22, which is really, very detailed, looking at it with an annex with concrete examples. And it says what we need to do is to align the strategies. We need to make sure that, we are complementary, that we, do work together and maximize the impact. We need to align the legal provisions. We need to align the timelines. They also looked into state aid rules, and then the joint support actions that we also have in this context. Just something to mention, because I always notice when I speak about synergies that many people are not aware of it, but member states, they can transfer up to 5% of the cohesion funds, the structural funds, to any other program. And we know of some member states who actually gave 5% of their structural funds to GR-HDAB and say, please, we cannot, we have some difficulties, or we do not know exactly how to use this money, but we give you 5% and we want you to fund good projects on the reserve list that are from our nationals. Now, this is very often for monopartner grants, so contracts where you have only one beneficiary. And whenever a member state says, well, here is the money, take it and use it for good purposes in Horizon Europe to finance projects from our country, then the Horizon Europe rules apply and not the rules from the cohesion funds. And if the Commission is not using the money, they can give it back. So this is just an example of a possibility. And then the potential role of the supporting networks, I think it already has been said that we do expect a lot from the NCPs to promote synergies in the current programs, to guide and to train stakeholders, to provide feedback to us. We would like to hear about bottlenecks, about limitations. As I said, we're now in the process of doing midterm assessments of our programs. We're already looking at the future. We're already talking a lot about FP10. We don't know what will be the ultimate name, but this is something that we're intensively already looking at. So any feedback that you can give to us in this area is very interesting. And I'm sure that the synergies will become more important also in the next generation of programs. Thank you very much for your attention.
Thank you very much for a very comprehensive and important presentation. And for a sector that covers very important projects, you couldn't stress more how important is synergy for cohesion, for interoperability, complementarity, continuity, increased results, and cost savings, including the flexible ways for funding. We're a bit behind schedule, but we'll. Are there any questions from the audience? Mr. Stassis.
If I may, I'm not sure if this is the proper time to discuss it afterwards in the workshop, but I think you have raised a very important issue: the synergy between different funds. Cohesion and all this stuff. And although in practice, what we say, each fund has its own rules, its own eligibility criteria. When it comes to have complementary action, and you say, for instance, the Digital Innovation Hub, you see that the DEP is considering other limits and eligibility of actions. But when it comes to ERDF, depending on the operational program that is done, is something different. So this creates a lot of difficulties to the applicants, and unfortunately, I'm not sure if NCPs can help on this, because they are involved managing authorities, they are involved agencies in the European Commission. So what's your view, instead of solving the same problem by its managing authority, by its national state, if there should be something more guidance at a more central European level? And this is one issue that we would like to raise as challenges for NCPs.
Yeah, I mean, as I said already, we're really very well aware of this, that this is a problem. And the Court of Auditors opened our eyes with a very negative report and saying, you're just doing your own thing in your own corridor. You're not really aligning everything. You don't have the same basis, not the same. You don't even have the same timelines. It's not that we have a call and then at the same time you have a simultaneous call and saying you can now get funding from both of them. We're not yet there. And I do realize that it's not easy for NCPs. And we don't have a web page where we say, okay, there you can go and it's all clear. But we see that we are progressing with this action plan in RTD. Each time that we have an info day where we actually explain the calls, there is always now a session on synergies. You know, this is the call that we have. This is the timeline for those programs where we don't give 100% funding. What are the possibilities at that moment? It's not ideal. We're not yet there. Absolutely not. But we're trying to do an effort. There are workshops being organized. There was this big conference in February where they really looked at the synergies between the DEP and the cohesion projects. RTD is now, in the context of this midterm evaluation, really looking concretely to see whether they can get some figures. For example, 37% of stakeholders, you find them both in Horizon Europe Digital and in DEP, 37%. So that they're looking really at this, because we need indeed first to take stock, to say, where are we? And we are talking a lot, but I mean, that clearly is not sufficient. But what is the current situation? We don't have it. We don't have mapping. We don't have a database that actually gives us some information. It's exactly what the court says. You don't even know actually. And if there are synergies, it's by accident, by error. It's really quite patchy. So I think it's good that we are aware of it, that there is a problem, that we know the barriers, and that we are, trying to tackle them. And I believe in the next MFF, if we hear some echoes about discussions ongoing about programs that are research and then deployment programs being managed by the same managing authority with us, like now also, we're also quite, we deal with this and this and this. If you look at even the DEP, HaDEA deals with it. You have a joint undertaking, HPC, that deals with it. If you look at objectives of the development plan, the cohesion plans, you see the digital, you see the skills, you see exactly everything also there. But no, we're not yet there. I mean, I think at this moment, it is good to read, for an NCP to read all this background information that is there. This notice of the Commission of 22 is very good because it's very concretely giving examples, what you can do for each of the programs. This is an annex which really says examples. This is an example. This is what you could do. So I think little by little we will get there, but it's a process. Yeah.
And probably these flexible ways of funding that you mentioned help, because you mentioned various ways of funding different projects to make them have synergy. So probably that helps as well.
Yeah. I mean, there are good examples, and I'm sure also in Greece, there are examples where people tell us, yes, the matching fund, they were the digital innovation hubs, for example. Most of them are paid, most of them are paid 50% by DEP and 50% by the states, most of them. So, no, not in Greece.
Okay. Officially, yes. In practice, a lot of difficulties.
Okay. Yeah, not yet. Also, some of them are, I know they're paid by cohesion funds, some of them, yeah.
Okay, so it's something that we have to work on, but we're running out of time. So I think it's the turn of Mrs. Lipiatou from DG Connect, head of unit for the program implementation, to enlighten us as to the EU funding programs for health and digital transformation. Thank you very much.
Καλημέρα σας. Και από την πλευρά της Επιτροπής ευχαριστούμε πολύ για την πρόσκληση. So, I am Elizabeth Lipiatou. I'm in the European Commission 30 years. Of course, it's clear I'm Greek. And I'm 20 years head of unit in different units from climate change to digital transformation now. I'm very happy to be here together with Marina Zanki, Kathleen, Steven and Jean-François, close collaborators and colleagues we know since long. And also speak on from the side of the European Commission on programs we already addressed, but let's say take it a little bit from another angle. I want to say also on my side that we took note of your questions. And this in this afternoon, amongst other parts of the program, we have a specific session with Jean-François in which we will speak about all of the issues you care, including also synergies, that's an important issue, and other things, and maybe going a little bit into the future. So for my presentation this morning, I will try to be a bit, stay a little higher level and try to complement and not repeat to the extent I can information you have already received previously by my colleagues. So let's say I will try, I'm sure, no, I can do it. I'm sure it functions perfectly. So I have, I will, the request to present, the correct request to present DG Connect within the European Commission, a Director General in charge of making Europe fit for digital age. Let's say we are not the only ones, but have a very big part of the share. This is a key Commission priority expressed by the President, but not only. And within this context, DG Connect, who is a Director General who has a history, is there for a very long time, and it is an important also in size. It supports the digital transformation and invest in by investing in research and innovation, deployment of green and digital technologies. I want to say that DG Connect is one of a bit different DG in the following way. It's a very strong DG on the policy side. I think we are amongst the two top Director General in legislation. So enough to see our side, to see how much legislative actions we have done on very important topics. We will come back to it. But also, we are implementing directly programs. So DG Connect is implementing part 4 programs. So it is a Digital Europe program, Connecting Europe Facility, Horizon Europe, and Media, and collaborates in this context or delegates implementation of programs in 4 executive agencies. And here, for the respecting the interest of this audience, I will focus to Digital Europe and to Horizon Europe Cluster 4, so digital part. And so for this one, the executive agency we work in particular is HaDEA. The same it is for CEF, but I will not focus on it. A lot it was done, and I'm here to speak to you in particular of Digital Europe, because it is a new program and because it came in this MFF to fill a gap, and the gap is deployment. So it is a program that it stands in its own, and it is important enough, and we hope it will continue in the next MFF. It is complementing important programs like, for instance, the Framework Program for Research and Innovation, and it is there for decades. Its present name is Horizon Europe. And also is a site of other programs. There was a slide showed before, and we will come back to this in this afternoon. CEF, EU for in many others, and I don't want to repeat. So back to DG Connect and how it looks. It looks like that. And you can see even by the number of units that is a very important Director General. Don't worry. I know you are a bit tired, but I will try to say that I don't go through this. But there is in green the units that implement Digital Europe, and part of it or are involved in a way. And there are in blue 2 units in which they are more horizontal units and are in charge of policy and implementation and coordination of Digital Europe, and one of them is mine. So I want to say that on the implementation part, DG Connect implements directly 25% of the program. Another 50% is implemented through joint undertakings, and we will come to it. And another 25% is shared by different bodies, including HaDEA. So it is indeed, on this side, a complex program, but it is a new program, an innovative program, and it is made like this because respecting the needs of the stakeholders on this very new and continuously actually emerging area of digital transformation. So on the objectives of the Digital Euro program, and here I want to say there is a little confusion, and I realize it in our slides, is the name of the program is Digital Europe with small letters. Its abbreviation is DEP. But there is one language in the European Union than DEP. It has another meaning. So it was a nice idea to call it digital, but then it creates some confusion with other programs. So digital with capitals replaces Digital Europe and not the part digital. And then otherwise it is called DEP by all of us, then we don't speak that specific language. So here there's no problem from what I know. So the objectives of the program, you heard them before, is to improve competitiveness for Europe, to help assess societal challenges, just to mention the big one, climate change, and to also make sure that all regions in Europe have the possibility to take up and improve their skills on digital technologies, and also support small, medium enterprises, and of course, achieve scale through collective investments in important and expensive areas. So then I arrived to this slide. This may be, as we are midterm in this multi-annual framework program, you saw it, at least those of you that you are working with the program. And I think you should be many, because the success rate overall of Greek participation to this program, it is above 50%, what is quite good, even if the program is new. So these are the specific objectives of the programs. It was designed to have 5: high-performance computing, artificial intelligence, cybersecurity and trust, advanced digital skills, and deployment and best use of digital capacities and interoperability, with emphasis also in the public sector. Very recently, with the adoption of the CHIPS Act, we added 6 specific objectives. You can see this on the right side on the bottom, and it has now 6 specific objectives, which will, with the aim to promote European Union's leadership in semiconductor technologies and applications. I want to tell you that the fact that for a program that started only in this multi-annual framework program, and midterm we add another specific objective, it shows the flexibility of this program, that you do not find it so easily amongst other programs, in adapting to emergency and new needs. We all know that, you know well, much better than others, we come from this area of digital transformation, then there are changes every 2 years, and important changes. So this is why the program has been changed. And accordingly, of course, changes the distribution of money across the specific objectives. So the program, it is in the context of the overall policy and strong will of the European Commission to succeed with digital transformation. You can see this will through its policies. So it was already mentioned, but I will do it again, the Digital Decade policy, which is a framework. There was also a slide what it is in, but also I am sure you are aware of the recent AI Act, data policy, amongst many others. So all of that respond to the strong political guidance and support, if you like, of the Commission President and Council to advance in this area. and also to make sure that we advance in a meaningful way in what we call a twin transition. I understood recently, I was in the Delphi Forum, and I understood that when anybody spoke about the twin transition, was not clear to the audience where it was. So I managed to talk about the digital transformation and the green transition when it is much clearer, and you know well that the green transition is expressed by the Green Deal. So Digital Europe is contributing to this double transition. And you know, certainly, one of the key initiatives financed by the program, the Destination Earth initiative, which is a virtual representation of the Earth, and within this, the digital twin of the ocean, which is the digital representation of the ocean with a specific lighthouse in the Mediterranean. So, I think this slide repeats what I said before, but I think it is interesting for you to have them. In any case, at your disposal, the slides. Again, it underlines what I said with more words, but I think by this time I try to go fast. So I thought that maybe it will be good to speak about the achievements of Digital Europe program and to put it on the side of other big programs. And I will speak about it from the side of the Commission that implements also part of Digital Europe and also part of Horizon Europe Cluster 4. So then we had so far 50 calls and 46 topics open for this program. Yeah. So, and so far, this call opening and evaluations went smoothly. So we have, you asked before, how can we be helped? A lot of guidance, which you can find on the Digital Euro program specificities, for instance, on ethics. There are, as you know, on the topics we are talking, ethical issues, on security-sensitive projects. You also heard briefly about the processes on assessing if an entity is EU control or not. We have foreseen to talk more about it in the afternoon. So about classification of information, so you can find that there. Then I come to the national contact points. So Digital Europe didn't have a national contact points network because it was new, because we thought initially that we give emphasis to put in place the new program, and also we thought the national contact points from other programs could fill the vacuum. It was not the case. The objectives of Horizon Europe, Cluster 4, and the objectives of Digital Europe are not the same. Neither are the same the objectives of CEF, digital. So it was a very strong request from the stakeholders, but also even stronger from our program committee to come with a specific dedicated national contact points network for Digital Europe. So this is why we had, you know, recently, very fast decided, and we published a call for proposal. There are two things that happen. We ask member states and associate states for nominations, and also we publish a call to have a project to support this network. You know also, I suppose, that we are managing directly from the European Commission the national contact points of Digital Europe for the reasons I said before. It's a new program. So, and here we have now, we had an overwhelming response from the member states, and we have the amazing number of 130 national contact points from 34 countries, you understand, member states plus associate countries. but 130, it means there are some of the member states, and not only the big member states, then they have more than one. So indicating clearly the importance that the program has for them. And the fact that, yes, it is complex, replying to a complex need, but needs to be understood. So strategic autonomy. This is something you heard quite a lot by our commissioner, Mr. Breton, in this commission. And this is something that you have a lot of examples how important it is for Europe. So Digital Europe program was designed from the beginning to reply to this. This is why at least 4 of its specific objectives have restricted, what we call restricted calls, calls that they are only for entities controlled by the European Union and associate countries, depending the call. So, and inside the program, there are 2 articles, 12.5 and 6. There are some more, but I give you the key ones in which explain what I'm saying, how the program replies to this, and what are the restrictions. So we have information in the founding and tenders portal we put on this specific feature of the program, and is what we call a corporate guidance, which applies the same for Digital Europe, Horizon Europe, and CEF, and EDF program. I think that shows in practice the will of the Commission to address common things in a common way, and we understand that yes, there are many programs, yes, they have different rules, and it's important to simplify. And I think you can agree with me that even if we have really long road together, because we are not alone to go on this road, we have the founding and tender portal, which you can find a lot of information on many programs. A lot of rules are similar. The evaluation processes, for instance, is not very different in Horizon Europe or in Digital Europe or in CEF. And also, for instance, on something that you see only in this MFF, strategic autonomy, and I can tell you firsthand, because my unit is dealing specifically with that, with Digital Europe and Horizon Europe Cluster 4, which we implement the part we implement directly, is very difficult to implement. And still we have managed to have a corporate guidance on the foundings and tenders portal. So yes, we need to go, but yes, a lot of things are done. And if the programs are complex, and if the programs are many, are also coming as a reply to the member states' requests for European programs to address many topics and many different features of those topics. Okay, it is evident that many years on the European Commission, correct? And I try to also show the positive side. I thought also that to show you what it has been successful through this new program in the few years it is running through the different specific objectives. So specific objective 1, the slides are for you. I will not read, but I will highlight in the part high performance computing that there is a procurement for Jupiter, Europe's first exascale supercomputer. I would like to underline, Kathleen also spoke about it, European Digital Innovation Hubs. We finance 151, a network of 151 European digital innovation hubs in all countries, as well as Iceland, Norway, and Liechtenstein. Each country, depending the population, has the specific number of European digital innovation hubs, which aim to help small, medium enterprises and startups to be better with new digital technologies. And this is for free, financed by the European Union and member states. Amongst those, for Greece, there are 7 in all Greece. I mean, okay, you can imagine more are concentrated close Athens, but not only. I have the list, and in the afternoon we can talk about it. So then, in specific objective 2, we have what we call technologies experimental facilities, and they have been established on many important areas, from agri-food, healthcare, etc. And then, oh, sorry. And then we have the specific objective 3, cybersecurity. That is really complex. And here it is implemented, or actually will be implemented, because still the cybersecurity center is not fully operational, not fully independent, and that meant even whatever it is on SO3 is implemented by the European Commission, Directorate, I mean, where I'm coming from. But here I want to say that in preparing for this, there are already 27 national cybersecurity coordination centers. An SO4 on skills, relatively on budget terms, and I didn't speak to you about it, but I think it was shown before. This is not the biggest specific objective, but it's very important. You know how much need there is for digital skills, especially advanced digital skills, and the European Union. So far, through this program, 2,500 students and participants were part of the first digital master program co-organized by many member states. We realized that not all member states could have masters on an area by themselves. So the program gives the possibility to join forces. So then I go to SO5, and again, I want to mention here as a success story of the program, safer internet centers established in most member states, providing safety information. So you know how important it is. We know in Greece as we know in other countries. What I can say is, before I arrived, I think, at the end of my presentation, but I can give you some more information. Here you have websites which I think you will find useful. I want to say that the publication, there is forthcoming the Call 7 publication of Work Program 23-24 for Digital Europe at the end of May. I said before that the publication of, we are working on Work Program 25-27, and the first publication in Q1, so the first 3 months, take out January, you have it. And I want also to say that we have several trainings for the national contact points. And the next one, on Call 7, it will be, is not yet announced, 21st of June, in which we will present that. And I think we will present something else, which I believe will be, we will please our NCPs, but also all you, a dashboard, which it will be public. And so far it was available only for our program committee members, but now we are finalizing a version. It will be available to all of you, to our NCPs in particular. They push us quite a lot. And to all of you, in which you could find a lot of important information on who is participating, percentages, partners, all of it. So I think that is an important date. I think I will stop here, and that's contributing in my way, keeping a bit.
Thank you very much.
Using the delay, I'm available on any question, and in the afternoon with Jean-Francois, we have a session in which I think jointly we will take care of all of your questions on this program.
Thank you very much. If there's not any question, we'll have the opportunity to to talk again with Mrs. Lipiato and our speakers. So what we intend to do is to have the lunch between 1 and 1:45 and have now our NCPs to give us the experience from the Greek participation in these projects. So we'll leave the floor to the 4 NCPs to give us their experience.
Hello, everyone. My name is Sofia Xesfingi. As I usually say, my last name is difficult even for the Greeks. So you all know me as Sofia. Let's keep it that way. Since we are running out of time, and also I do not want to represent what you have already heard about the cluster health and the cancer mission within Horizon Europe, I will go directly in discussing the challenges on behalf of the Greek applicants that, as you also heard, us as NCPs are gathering the majority of difficulties you are facing, the problems you're having, and all the rest. And you also heard that you have a lot of responsibilities in doing our jobs. So if I'm doing my job well, I think I'm doing it. So far, you already know what Horizon Europe stands for. You heard the type of actions, whether there are research innovation actions, coordinating supporting actions, or the co-fund actions. You can see here all the DGs and authorities that are collaborating in order to create the strategic plan for the cluster health. You are aware of the 6 destinations that are running within cluster health. And you heard already that there have been 3 new topics added in the work program for the 23-24. I want you to see and participate to the Horizon Europe Info-Day will take place in 2 weeks from now, 28th of May. And you can ask directly your questions to the representative of the European Commission there. The same more or less hold for the cancer mission, one of the EU 5 challenges. You know that the aim for this mission is to save the life and the quality of life for more than 3 million persons by the 2030. Now, what we are doing as NCPs in order to address some of your challenges. First of all, we are the participants, the Greek participants in the National Health NCP Network, HNN3. What we're doing here. I know that all of you, or the majority of you, usually wonder in which all can I apply. In which proposal would be better for me to channel my assets. And where can I find information, or when I can find the correct, let's say, partner or a well-established big consortium I can join to. Some of these challenges, for example, with respect to the fragmentation of information usually you are facing, you can find them here in the website of the HNN3. Although we have a calendar for all events, news, and everything related to health within Horizon Europe, you can also find all open calls, no matter what, if they are under cancer mission, under cluster health, all the partnerships, and other health-related programs, such as Digital Europe, for example. So where to look? Go directly to our website, healthncp.net, or you can go, of course, as you already know, under the funding and tenders portal. The good solution we are providing through our website is that you not only have the calls that are now open for submission, but you can also get some basic information about the forthcoming ones. So apart from these 2 websites, also, as you already know, you can ask us, the NCPs, or join us in our info days, national ones or European ones, in order to get all the information you need. Subscribe to our newsletters. On my behalf, for example, you get more or less one per on a monthly basis. Participate in brokerage events that are really important in order to find partners. And of course, you have to take advantage of your personal networks. The biggest problem that it would be good to discuss it with the delegation of HaDEA here presented is how to join a European partnership. You know that there are a lot of partnerships. There are 49 of them in the European level, and 9 of them are dedicated or somehow related to health. Under these 9 partnerships, the 2 you see there, the IHI and the EDCP3, are institutionalized ones. So that means that you can join and participate in one project proposal. And it doesn't matter if you have national fund for claiming your expenses or not. You can join no matter what. The other 7 partnerships, though, there are on a yearly basis changing. So this year, we are not participating, for example, as Greece, in the transformation of the healthcare system, but I know that next year will come. So somehow we have to be prepared in order to give these informations to all the Greek applicants. You can see here, first of all, my presentation also will be disseminated through our website. So the majority of information is there for you to get it after the event. You see here, for example, one among the institutionalized partnerships that still has an open call. It's ending, the deadline is approaching. You see here, some health-related calls I already mentioned under the Digital Europe program. You can find it in our website in HNN3 or under the funding and tenders portal. And another hot topic, usually among the Greek applicants, is the cascading funding. The terminology used for the financial support to third parties. You can see as well that there are open opportunities, open for submission opportunities for you. The challenge here is for us to connect you to the right person. I'm not responsible to have all the information about a project or a program that is not under the Cluster Health or the Horizon Europe in general, but we need somehow to get in contact with the right person for each of these opportunities. So for me, a challenge is to get the right contact list, mailing lists, whatever, some contacts for each of these initiatives, projects. Okay, let's continue with another difficult field here, the PCPs and PPIs. You see that there is a complementarity here and between the 2 concepts. Now, one of the 3, one topic, pre-commercial procurement is open now for submission, is one of the 3 topics added to the Cluster Health Work Program. You have here some examples you can consult in order to see how some PCPs can conclude in funded PPIs. You have here also the hot topic of synergies between all relative initiatives, infrastructures, digital transformation, innovation. We are all close working together, in order, because you're going to find the word health in all of these initiatives and programs. And I will conclude my presentation with the Enterprise Europe Network. Is another European funded project. What we are doing there, the EEN, in short, is divided into 15 sector groups. It happens to be, I happen to be the chair of the health sector group. So what we are doing there, we put you in direct contact with international partners in order to build a consortium or to join an already existing one. So get in touch with us in order to better connect with the right partner in each case. It doesn't have to do only with research and development proposals. You can also do it for your business or technological offer or request you may have. That's all for me. I wish you'll take the opportunity to discuss directly with the delegation here instead of writing an email letter to me and ask me to ask them something. I wish you take the lead and directly communicate with them responsible ones. Thank you.
Okay, thank you. Let's move to Mr. Roidis from same institution.
Hello, from my side, I'm Mario Zoidis. I'm national contact point for Horizon Europe cluster for mostly for digital and industry. So, despite this, I'm also innovation consultant at the Enterprise Europe Network and also coordinator of the Greek EIT Health Hub. Here you can see the the structure of the Horizon Europe, but we have seen it also this, and we saw about the general vision of the Cluster 4, which is about it's mostly about the twin transition, which is the digital transformation, but always keeping on mind the climate neutral and circular and clean industry, and we always have the human in the center. Here you can see some of the policies the strategies of Cluster 4. We see the Green Deal, Europe Fit for the Digital Age, the Space Strategy for Europe, the Circular Economy Action Plan, etc. And now we can see the 6 destinations that we listened before. And we can see with which strategies they are somehow combined. For instance, the digital decade that we heard, it goes with the destination 1, the 3 and 4, which are for digital, and the 6th also. And here we can see the destinations. These go by, the first 2 are mainly for industry, the 3 and 4 are for digital, the 5th is for the space, and the 6th destination has both of industry and digital. And here you can see the open calls that we have, there are now open and for submission. Here we can see the destination for it's to research and innovation actions. And the destination 6, we also have coordination support actions. Did we say what this? So it's okay. And last, we have these last calls and the cascade. I'm just moving fast because it's also lunchtime. So, but now I will go to our major contribution, which comes from our networks. They say that your network is your net worth. So I strongly believe that these projects that we take place, that we participate, is the ones that give us more information and the ones that help us enrich the services that we give to our customers. First of all, it's the Idealist project, a network. Where it's my window, it's also the site. It's Idealist as you see it .eu. And what we do there in Idealist projects, we are 65 partners participating from all countries, and what we do is trying to give information and any whatever kind of assistance we can provide to the Greek participants. It's one of the oldest networks since it's operating since 1996. And what do we offer, and what is the ones that our customers in some way. First of all, it's the experience that this network has since it's operating since '96, as we said. There is a great expertise in proposal writing and project management, since in this project they're participating all the national contact points from all the other countries. So in this way, it's quite easier for us to communicate and to send and receive requests and whatever is needed from our clienteles. We also provide information services. This happens by sending our newsletter, the briefings, the posts that we do on social media, and all other information we have about the work program and the events. And talking about events, we do participate in brokerage events that we disseminate them, and so every proposer can participate and find the right partner to collaborate and to join a consortium. But we also do, before the submission process, we do full proposal checks and pre-proposal checks, which is we do them with experienced evaluators from the European Commissions, and we try to check the proposal outlines. We also have a toolbox, which is a tool to support proposers during the whole application process, from the project idea to project completion and future planning. And last but not least, we have the topic tree, which is a tool where you can identify all historical and future links to call topics, and they can offer you background information, which is provided by DELIST, but also from European Commission's Funding and Tenders portal. This is about the digital network. Now we go to NCP for Industry, which is the network for the industry NCPs. Actually, here we more or less have the same responsibilities, and we give the same information. And the third one is Cosmos Space Network, which is the project for space of Cluster 4. It's coordinated by our colleagues Praxi Network. And yes, this Vagepteli and Yannis Kortidis are our national contact points for space. Now, I briefly say what Sophia also mentioned about Enterprise Europe Network. Generally, we strongly believe that collaboration is the new innovation. So as innovation consultants, we always try to collaborate and find things how all parts can cooperate and give something greater. Here is an example. And last but not least, since we're HaDEA, and at this point I would like to give a big shout out to my colleague, former colleague George Megas, who is also the responsible, who was the NCP for Cluster 4, and is the father of Symbiosis, which is a project that we are implementing it at our EIT Health umbrella, and we try to get in touch the hospitals and all the startups that work either on the digital industry and generally in the health industry, so they can combine their knowledge and their forces in order for the common good. And that's all from me. Thank you very much. And I pass the floor to
Thank you very much. The floor is to Mrs. Eleni Chaniotaki, NCP for the Ministry of Digital Governance.
So I am coordinating NCPs for Digital Europe program. As a minister, we have the responsibility of Digital Europe program for Greece. So we're NSPs, and because DEP is a new program and we don't have previous experience as NCPs from other work programs. And all I can speak about is challenges we have faced so far. And I'm glad to find out that some of the challenges we are facing are also being faced by DG Connect or have been answered before. So first of all, what we experience a lot is we have a lot of comments or even complaints for applicants that DEB eligibility criteria are quite different from other funding programs like NSRF or RRF. This is a comment that Mr. Antonis mentioned earlier. And we heard, of course, the presentation by Ms. Kathleen Engelbosch mentioning that this is something that is being addressed, and this is a concern that is already that they already have in HaDEA. So this is the first, and this is the most important challenge that we're facing. We have a lot of questions, and our answer is that we're waiting for a solution from the European Commission to that. The second challenge we have, and that has been addressed already by DG Connect, is the absence of a regular reporting system, which I believe is it the dashboard that is being prepared, or we don't have a reporting system, so we can see, we can have info about how many proposals have been submitted or accepted or rejected, and so on and so forth. Okay, so I'm glad that this has been addressed, and it's a very common request by our political leadership to have info about this, and for the time being we cannot provide this. So another challenge we are facing is that regards the sustainability of projects implemented by academia and businesses, and this is due to the lack of synergies among academia, businesses, and public administrations, so that the outcome of projects they don't reach, they are not diffused to public administration. I'm not aware how we could solve this problem. Maybe we can have more mixed consortia consisting of all three of them, so academia and businesses can show us the know-how of things, and we can be implementers, or we can be pilots maybe. And fourth challenge refers to the complex procedure for guarantees approved by eligible countries with no specific guidelines by the European Commission. So the eligible country requests guarantees, and these are afterwards assessed by the European Commission, which is a little bit complicated, and there are no specific guidelines. I'm not much aware of this, how that could be addressed. However, these are the main. Okay, that would be good. However, these are the main challenges and issues that we are having for the time being.
Thank you very much. Yes.
Ms. Lydia can answer that?
Yeah. Yes, please.
All right. For the first things you mentioned, etc., we speak in the afternoon. But about the guarantees, you speak about restricted calls. And when, okay, because we have to explain what it is, put it in a context. So in Digital Europe, and to a less extent in Cluster 4 of Horizon Europe, and also in some calls of CEF, we have restrictions. Now, if we come specifically to Digital Europe, you are NCP for Digital Europe. I believe it comes from there. We have two articles. We have restrictions with guarantees when we have the application, and you can see that in the call document on Article 12.6. There, if an entity participates well, if we have the application of Article 12.6 for the topic X, again, very clearly stated in the call document, then the central validation services is located in REA, but that is irrelevant, is the central validation service of the European Commission for all programs, is assessing all entities participating in this specific topic. Okay, needless to say, we don't do it for everybody, but those that they risk to be financed in the list, first in the list. All right. Then, if one of those is assessed as non-EU control, the assessment is simple. EU control or non-EU control. If it is assessed as non-EU control, and there are many, I mean, the way it is assessed, the description, you can find it in the link I show you, but you know, of the corporate guidance in the funding and tenders portal. So it is assessed non-EU control. The entity has still the possibility to participate if, let's say, it's located in Greece, if Greece guarantees, then if that entity participates, even if it is controlled by non-EU, I don't know, by which country you want me to say here, whatever you have around, the security interests of the European Union are safe. So is in your member state, if you wanted to participate, is your security, is not the security of the Commission. Huh? So then you need to have guarantee. What it happens is the entity prepares the guarantee, says, I confirm XYZ, the XYZ are in the corporate guidance, and in addition, the form that the guarantee is taken is available online. If you don't have the sites, I give it to you. So then it prepares this, it submits to maybe your ministry in that case, because your representative in the program committee gave a contact. So it says, for the guarantees, the contact in Greece is. So this entity goes to that and say, voila, the guarantees I can give. And this, the member state, it says yes or not. If it says yes, that comes to the Commission. Now, correctly, we do not take it because it is, we also assess it. But there are very few cases, but there are, we didn't accept the approval, I mean, the guarantee approved by the member state. But there are cases, because there are member states, they say, you can see in their approval processes, there is no effort, let's say. So then we have some cases, but they are very few. So that is the issue. So I understand it's difficult, it's new, but there are, I mean, you can find the guidelines and information. And we are there also, through especially through the program committee representative.
Okay.
To have a full picture of a company if it's controlled out of European Union. And the guarantees seem to be very difficult. And we were wondering if all these requirements have been somehow guidelines, specific guidelines for each one of them, what is acceptable. Because we may run in a very bureaucratic process, have an outcome, and afterwards the outcome will be rejected or will be...
Okay. First of all, that if you, as a member state, you do this work and you say, I approve what this entity puts as a guarantee, and it's only you can know, not the Commission, because this is here in that case, 98% the Commission will approve your assessment. Point one. Now, point two. There are two ways, you see, and on that, as I always say, because I often speak about the guarantees, also in the program committee and in other places, and the overall processes of strategic autonomy, we are together on this. Either we apply Article 12.5, so an entity whose control is out, That you member state, I don't want to say Greece, you don't like it neither. Or we applied 12.6, which by the way we co-decide through the program committee and the work program approval. And in that case, even if it is non-EU control, you have the possibility to assess it and say, all right, I have here in Greece, I give Greece as an example, an entity controlled by, I try to see a state here, controlled by Lebanon. Voila. Is in Greece, but is controlled by Lebanon in the percentages. I mean, there are also other member states and non-EU, but the main stakeholder is Lebanon. But is here, I know this entity as a Greek state, and yes, even because if it is under 12.6, it's very sensitive. I don't know, it's topics that you don't want it goes. You don't want the money we have at the European Union, then you put, by the way, it's not ours, then we use them to finance, I don't know, Chinese companies to compete with whatever you have in member states. This is why there are these restrictions. It's not because we thought it's easy, and I tell you, it's very difficult internally to implement it. I have to say that topic I know to the smallest detail. So, and we do it to protect the strategic autonomy of the Union, not of the Commission, of the member states. So then you have to say, yes, even if it is Lebanon who is the key partner here, I guarantee that I take care, I assessed what the entity said will do to secure that it doesn't go things outside the Union, and I approve it. And then we agree on this. 98% we will say yes. Now you tell me as a member state it's difficult. I have to tell you, you are not alone. Many member states complain. Some of them are more successful. It's for all of them is difficult and it's new. And I have bad and good news. Bad news. In the future will be more. Because where we are in Europe, we need to protect more. Nobody outside Europe gives money to Europe to compete in their state with the money of someone else. So now, finally, we say, okay, for some things we need to be careful. AI, I don't know, cyber, other things. So now, this is the bad. The good is there is more information and more experience now than at the beginning. At the program committee, we had a presentation with some member states. They are more successful on that, and they explain how they do it. So now, if you want, again, we can come also from the Commission on specific things to present. We can do it. You can ask to have the specific training. We did already, but again with the national contact point and the program committee, and ask them to disseminate slides on this.
Last but not least, Mrs. Vasiliki Karaouli from NCP from the Ministry of Health.
So good afternoon. I will try to do my best in a matter of time. I will say briefly some words about the NFPs and their role. So they are the national experts for the health program in EU countries and also in participating countries. They are appointed by their national health ministries, and their specific role is to assist in the implementation of the program, the dissemination of the results, and the information on the impact generated by the health program. Their responsibilities are also to act as the main contact point between the European Commission and the member state, namely Greece for us, disseminating information about the EU health program initiatives, funding opportunities, and goals. And also provide support and guidance, monitoring the implementation of the funded projects, and engaging with all relevant stakeholders. the role of the NFPs for the EU health program was defined as confused. And that was a reason for which a joint action NFP for health was funded. And it is the joint, this joint action aims to strengthen the network of NFPs and offer applicants and beneficiaries information and guidance on the EU3 program. And it is an ongoing joint action. The Greek Ministry of Health participates in a large number of joint actions of the EU health program. And surprisingly for us in working in the Ministry of Health, it is the first time that the Ministry of Health is the competent authority for a joint action because different authorities used to be the competent authorities within the third program for health. So we know this EU health program aims to emphasize on the prevention, the improving of management of serious diseases, the digital transformation of health system, and the strengthening of EU capacity to manage major health crises. Here are some examples of the direct grants allocated on 2023 and 2024 to different competent authorities. We know that EU for Health has indeed a strong focus on translating innovative health and social research into practice. And Greece has taken advantage of the opportunities provided to strengthen the health system terms in terms of resilience, efficiency, and health promotions. We mention here some challenges. Some of them are we can say that the application processes are more or less complicated. We can have administrative and technical burden, especially for small countries like Greece. Another challenge is the dissemination and the engagement. But we realize that info days and webinars provided are a great practice that perhaps should be further expanded. And other challenges can be the availability of necessary resources that in some cases funding opportunities may prove to be limited and insufficient. And the alignment of national and European priorities in some cases with national health system need and those of other member states may be a daunting task, although the advantage of the joint actions is the added value of the countries joined together in order to have a common goal. Sometimes, although we can have a deviation of the goals. And some solutions to these challenges, as we have thought, efforts to address these challenges could include further streamlining application processes, bolstering administrative capacities, enhancing cross-border collaboration procedures, enhanced support and guidance to the member states on project management could, to our opinion, alleviate some of these challenges, enabling more effective participation. I thank you very much for your attention.
Thank you very much. Yes?
It's not a question, it's just a short comment. Just because some of the applicants may not know the difference between NCP or NFP, between EU for Health or Cluster Health under Horizon Europe. I just want to mention something that I forgot previously. Both networks, NFP for Health and HNN3, also working on synergies. They have created some fact sheets that are highlighting the differences or the similarities between both programs, and they are also available under our toolkit in the HNN3 website.
Okay, thank you very much. Thank you for your attention, for your patience, and please proceed to get some lunch because you must be hungry. We have a question and answer session later, so please keep your questions for later because we've run out of time.
Hello everyone, Kalispera. My name is Florina Telea. I am the head of unit in HaDEA, dealing with grants management under the EU for Health program. It is my pleasure to be there here with you today and to chair this first thematic session dedicated to synergies across Horizon Europe Cluster 1 and EU for Health program on digital health. So first of all, let's clarify what is the digital health. So one of the flagship initiatives, as you know, is the European Health Data Space, EHDS, and which is set to make a revolution in the health care area in the EU by providing citizens with more control over their health data and by stimulating innovation. The EHDS will facilitate the sharing of health data across EU borders, ensuring seamless healthcare across healthcare access for citizens during travel or relocation. The EHDS will also foster a competitive market for electronic health record systems, encouraging innovation and enhancing health care quality. It is also a framework governing the use of health data across the EU, respecting at the same time the member states' autonomy in organizing their health systems. And as you might be aware, the legislative proposal for EHDS has been agreed upon by the European Parliament and by the Council of the European Union, with the final voting scheduled for this autumn. Ongoing EHDS relevant projects managed by HaDEA span across the EU for Health program, the third health program, and Horizon Europe. So they include direct EU for Health grants, joint actions, procurement actions, Horizon cooperation and support, and research grants. These different instruments complement each other and offer a range of opportunities for engaging with different stakeholder groups relevant for the HDS, such as national and regional authorities, public health institutes, hospitals, patients and citizens, research institutions, and industry, in various ways in order to create a maximum impact. HaDEA presented at both Digital Health Greek conferences, the Athens Digital Week and the Health IT Conference, advocating for the EU for Health program and showcasing the progress of Greek projects. We are happy to see that Greece is actively involved in the implementation of several projects within the domain of the EHDS, contributing to the digital transformation of healthcare in the EU. The Greek projects such as Xt-EHR, joint action, ELENA, direct grant to member state, EU-VAC, direct grant to member states, multi-beneficiary, or TEDAS2, the joint action. They each address unique aspects aligned with the overarching objectives of the EHDS. So what is the scope of our discussion today of this session? So it is shaped as it is a clustering event, and the aim is to bring together projects in the same area, in the digital health, to drive synergies. So we will discuss today the aims and outcomes of the invited projects to which Greece participates, showcasing Greece's contribution to the EHDS implementation and the broader digital transformation of healthcare within the EU, We will also promote synergies among all actions dealing with digital health, irrespective of the funding program of source, be that EU for Health or Horizon Europe. And we will provide a forum for discussion on expectations from EU funding, exchange of experience from project and joint action implementation, and synergies from a national stakeholder perspective. So after this short introduction, and I will give now the floor to Stefan Hogan, my colleague from HaDEA, who will moderate the session of today. Many thanks for your attention.
Thank you, Florina, and thank you all for being back here this afternoon. And I'd like to also especially thank all the speakers that will soon start presenting their activities. I would just urge you to try to keep to the time, unlike we did this morning, so that we can try and keep within the new schedule. I just want to add very briefly to what Florina did to introduce the session, that we make a lot of efforts to foster clustering of projects. And by that we mean bringing projects which are individually already collaborative efforts to collaborate further within the topics they have been funded, amongst other projects from the same topic where there's a great logic for them to collaborate. And sometimes this is actually requested in the topic. Other times it's not requested, but it seems logical, and we try to create the conditions for that. But with this type of event, we try to go a step further and try to foster collaboration or support collaboration, because we know in some cases it's happening already, between projects that are coming from different programs. So we're coming back to what Kathleen presented this morning about synergies. We're really looking to create the conditions to facilitate this. So we're very grateful that the organizers allowed these sessions in the afternoon. But it will allow us to explore that further. So that's all I wanted to say. So now I would like to introduce the first project and speaker. It's the Xt-EHR project, and presenting will be Andrea Nucleos. Apologies for the pronunciation. And then we will have a short intervention from no, that will be it for this. Just one speaker for this project. So please go ahead.
Yes, thank you. So this is a joint action project. It involves almost all the member states, and it is for the primary use of health data to define implementation guides. So as I said before, in this project, we will promote the adoption of the Xt-EHR except format in all EU EHR systems. Something that it is very ambitious, but we will promote this adoption. And we will promote the EHRs and cross-border healthcare use cases beyond the MyHealth. It will promote the EHR systems and wellness apps certification and labeling process in the European digital single market. It will provide proof of sustainability of the selected use cases. It will provide adequate technical specifications and implementation guides to allow the adoption of the EHDS regulation across member states. And this is one of the most important objectives of this project. It will expand on previous and cooperate with other projects and initiatives in the domain of digital healthcare interoperability in the EU. And it will reuse all existing management and governance assets of digital health and interoperability in Europe. This project builds on other projects, previous projects, and including EPSOS, Expand the Age, Xt-Health, and so on, which means we will take the outcomes of this project and we will use them for our objectives as I described before. And this project will, as I said, build on this to create cooperation among member states in terms of interoperability and how this healthcare data will be exchanged, to prepare the foundations for improved primary use of electronic health data, to support the new regulation for the European health data space, and to empower individuals, after all, to control their health data. Now, it is, of course, strengthening the health systems in Europe, and this is how what we say and what HaDEA says, a Europe fit for the digital age. So it works towards this. This, of course, involves, as I said in my introduction, almost all the member states in this project, 28 countries, 55 organizations. Yeah, it was a little bit short, my presentation. I didn't want to spend all the time, but if there are questions, I'm happy to discuss with you.
Thank you, Dr. Neocleous. Sorry. Thank you for joining us from the National E-Health Authority of Cyprus. Thank you for also keeping your presentation short. Are there any questions to the speaker? Clarification questions at this point? No, not online, not online, and not in the room. So we'll thank you, and please stay online for the discussion in a few minutes. Okay.
Excellent.
Thank you again. Thank you. So that's a great start. I'd like to move on to the second project, which is also an EU for Health project, the GR-HDAB project, and presenting will be Mr. Vasiliou, and I hope you're ready for us. Dr. Vasiliou is from GR-Net.
So good afternoon from me as well. I know it's a difficult session after the lunch break, as always. I will try to keep it short and sweet and vibrant, as much as vibrant as I can. So my name is Haris Vasiliou. I am Digital Transformation Strategy and Innovation Advisor at GR-Net. And I would like to thank the organizers and HaDEA for this invitation. I'm representing also colleagues from the different organizations involved in this project, primarily the Ministry of Health. That's unfortunately was not able to attend today, as well as Υγεία. And the presentation is going to be about, as previously said, the project called GR-HDAB. And we've seen the previous presentation associated with primary use of health data. But equally important to the HDS regulation is obviously the use of secondary, the secondary use of health data as well. And taking into consideration of the recent common agreed legislation that has passed through the relevant stages of the Commission, it is critical and of great importance to start implementing that infrastructure also here in Greece as well. So a few, let's say, some time ago, the Ministry of Health had the visionary initiative to create a working group to work on the HDS regulation, both in terms of the actual legislation and the discussions in the Commission about the negotiation phases, et cetera, as well as the element of preparing different proposals, different projects to be associated with the implementation of the HDS, both in primary use and secondary use here in Greece. So we see through the regulation a very, well, if not complex, but a very important journey that we need to cover, starting from looking into the kind of metadata catalogs that you have in your country, applying for a permit for using this data, getting the permits, and actually preparing this data for analysis, providing a secure environment for analyzing these results, and then being able to publish the results according to the regulation. So the whole journey was part of GR-HDAB, which is the project that I'm presenting today. So the Ministry of Health, with affiliated entities of GR-net and Υγεία, started this journey a few months ago at the end of 2023, where the project has been initiated. And this is a 4-year duration project. That's a main aim is to actually develop this first Greek health data access body infrastructure that it is required to comply with the regulation. And obviously, this involves different steps. We need the governance model, which is critically and very important, but we need the infrastructure as well. And this project is associated primarily with that. So in certain countries, they have already proceeded well ahead of the regulation. In Finland, with FinData, with France, with the France Hub. So they have a better level of maturity, and certain other countries, including Greece, need to live up to this level and rise up to this level quite quickly. So this is the aim of basically this project. And in our case, we needed to focus on the business capabilities put down by DG Santé and HaDEA, respective to, first of all, create a catalog with the metadata that we need to provide an application, a system that would allow the different data users to apply for a permit, and then provide the secure processing environment for these permits to be materialized, for this data to be uploaded and used by the data users that have the respective permit. And of course, another very important and critical objective of this project is how to connect this local infrastructure with a central platform that is going to be developed and provided by the European Commission. So these are let's say, the two, as we say, core elements. One, how to create the internal Greek infrastructure, first of all, and then how to connect with the central part of the European Commission. Of course, we have another capability, which is the quality of the data, which is something that we want to look out in the future with future synergies and so forth once we have or started developing this infrastructure. And one of the core activities that we are also doing is the fact that we are trying to work with all the other countries. There is a community of practice set up by the European Commission, which is a very important and very useful and I must say a very huge well done and congratulations for this initiative, because I think it's very helpful for other countries that are not so mature, and we exchange information that is very useful for us as well to proceed on the development of these different systems that I presented earlier. And another important element that is putting forward, and also the three of these organizations that take place in this project also participate in TEDAS2. TEDAS2 is the, let's say, follow-up initiative of TEDAS, the initial project that was funded by the Commission in order to pave the way for the regulation. So going now one step further, we are involved also in that project, trying to merge everything together at the end of these 4 years. All the countries have more or less the same implementation plan, which is very important that we move along on the same dates, more or less, because for these systems, we need the analysis, which will follow up the development for the pilot version, and then the deployment of a scale-up version that can be utilized by citizens, by data users, data holders, and so forth. In synergies, we look into how our infrastructure, what we develop, what we design now, would be or can be connected with other initiatives, such as, for instance, Horizon proposals, such as the recent Cloud AI proposal that wants to utilize this type of HDABs, and other type of for different funding schemes that would assist us on getting there faster, let's say, or testing out what we are developing quicker. So these are the main motives that we are looking for through synergies. And with that, I close my presentation. I try to keep it very, very concise, and I'm available for any questions later on. Thank you.
Thank you. You certainly kept it upbeat and short. Thank you. Any questions in the room or online? Okay, so I think we're happy with those introductions to the various projects. We're now going to move to the 2 Horizon Europe projects, starting with Xt-EHR, and the first speaker presenting Xt-EHR will be Dr. Evangelos Markatos from Fort Helias.
Good afternoon, everybody. My name is Evangelos Markatos, and in the next, 5 minutes, along with my colleague Alex Berler, we are going to present the Xt-EHR project. Xt-EHR is about expanding the European EHRF to share and effectively use health data within the European health data space. It's a very long title, and let me try to unpack it a little bit. So it's about expanding the European electronic health record exchange format to share and effectively use health data within the European health data space. So it's about sharing data that adhere to a specific format and within a given domain, the European health data space. But before I move on into explaining what the project is, I would like to ask you a simple question. Have you ever shared a photograph, a picture with your friends in Facebook or any other social media? Has any of you shared any picture with friends? I don't see any hand up, but I don't really believe it because most of us have shared pictures, much like this one that you cannot see it over there because my picture is covering it, but it's a nice picture from the airplane. And you can easily share pictures on social media. You just click, share, and you have, do I have a mouse here? Can you see the mouse? Yeah, and you have a variety of options where you can share. You can share it on Facebook, you can share it on Gmail, on WhatsApp, everywhere. So it's really simple. So if you have a picture from your smartphone, it's really simple to share it with your friends or with chats or whoever you want to in social media. This is exactly what we would like to do with Xt-EHR for health data, for sharing health data, to make it as easy as sharing a picture with your friends. We have a button to do that, and we call it the Xt-EHR button, and we have given it a color for this button. The color is yellow, and that is why we call it the yellow button, obviously. It's not a yellow submarine, it's a yellow button. So in order to implement this, say, vision, which is everyone can share their health data in European health record exchange format with the click of a button, we need 3 things. 3 are the things that need to be implemented. The first is the button, the yellow button, which is the obvious thing. The second is the hub, which brings together global standards with industry and government to create a specification and accelerate adoption. And the third is the label, the industry label that demonstrates the commitment of the industry to implement the European health record exchange form. So 3 are the main things are here, the industry label, the hub, and the button. Xt-EHR will demonstrate the impact across continuity of care, clinical research, and population health. It will start with 9 adoption sites and select more than 25 ecosystem partners to accelerate adoption across Europe. It will demonstrate safe, trusted, low-cost sharing of high-quality, structured, coded health data. It will facilitate movement of digital health services across Europe and globally through standards. It will drive Europe's competitive advantage for research and innovation in the European health data space in the era of AI and big data. And the hub will be an accelerator into contributing to the adoption of global standards within the format. This is the overall picture of Xt-EHR. I'm not going to go into the details about that. It's basically the work package structure of Xt-EHR. We had our kickoff event earlier this year in this city, in Athens, during the Athens Digital Health Week 2024 on 17th of January. And you can see some pictures here. I'm this guy over there, and this is most of the consortium. So it's a big consortium. As you can tell from the picture and the logos up there, it's a big consortium. The coordination is by Medcom and HL Europe, but there are several different partners, standardization organization, SMEs, technical partners, universities, research centers, and they all collaborate in order to implement this Xt-EHR vision. Now, as part of this talk, I was asked to say a few things about what am I going to do, or my organization is going to do. My background is in the area of security and privacy, IT security and privacy. We think that people will adopt the button if they trust the data, if they feel safe within this environment, if their data are protected and the privacy is ensured. So fourth will contribute towards secure data sharing and privacy-preserving data sharing. Fourth will contribute towards a framework for individuals to share their data in a secure way. And the main technologies to do that are anonymization, pseudonymization, and synthetic data generation. Finally, fourth will contribute to capacity building in security and privacy for citizens, health practitioners, and digital health developers. It will ensure the hub will have the highest quality educational resources in security and privacy, be pre-existing, those resources, or created through identified gaps. So, to summarize, with Xt-EHR, you will be able to share your health data as simply as you can share a picture in social media. EU companies will indicate their capability to share data within the European health data space with the Xt-EHR industry label. And Europe will facilitate AI-based innovation with the format, the European Electronic Health Records Exchange format. Thank you for your attention. Alex, would you like to add anything to that? Thank you, Alex. So that concludes my presentation. Follow our accounts there if you would like. Thanks a lot.
Thank you, Dr. Mercatos, and hello, Dr. Berler. Thank you for being here too from the project. It's, as you said, it's a vast project. I think over 30 partners and almost 7.8 million euro of EU funding. I think you'll need that too for this endeavor. So we wish you luck with that. Now let's move on to the second Horizon Europe project. It's the Expand project. And this will be presented by Dr. Zoi Kolitsi. And we may have also a second speaker. I think it's Dr. Christopoulou.
I'll take the couple of seconds too late while the slides are coming up to ask you two questions. May I ask you how many of you in this room are really aware of the European EHR exchange format? Not what you heard from Evangelos just a minute ago, but how many of you have encountered or have read or have learned about what the format is? Ah, very good. Very good. And how many of you three really understand what is the format? Now you're aware of it, but how many of you really understand what is the format? Yeah, I'm one of you as well. Yeah, I'm learning. So in Xt-EHR is coordination support action, and it helps understand the role and the challenges around the European exchange, e-health record exchange format, in a way that it supports the implementation of the regulation. And therefore, Xt-EHR is one of the few projects, together with Xt-EHR, for example, and I think in the future, Xt-EHR as well, that is the projects that are really directly supporting the health data space. And with this, I'd like to kind of summarize a little bit or position where Expand fits in this endeavor. The health data space is about primary use, and it's also about secondary use. When it comes to primary use, it is about fair data, it's about standardization, it's about governance, and it's about support. So the different articles of the legislation altogether explain how we can achieve findable, accessible, interoperable, and reusable health data. How do we leverage on standardization for it? What kind of governance do we need, and what kind of support is provided? And Xt-EHR targets these particular areas in ways that are explained here. It focuses on interoperability, on conformity testing. So when a manufacturer says, I'm now compliant with the EHRX format, how do we prove that this is actually happening? And on common specifications. The regulation has now been voted by the European Parliament. It is a reality. And very shortly, manufacturers in member states will have to comply with a set of standards, and they will have to prove that they comply. And member states will need to set up mechanisms to ensure and to surveil the market, to make sure that manufacturers that have participated in procurement actually meet these requirements. Therefore, this type of preparedness is necessary. And then how do we achieve reuse of data? By capturing data according to a standard common format defined by specifications and making this data reusable by in addition adding the quality label and utility label. So what is this data usable for? Harris explained a lot about the HDABs and of course this implementing legislation budgets and digital health literacy programs. So in a more specific way, Expand is supporting Article 6, the format itself. And now we can say as much as the format is data sets, what data sets do we need? Coding systems and values, technical specifications. Article 12, supporting cross-border exchange. Article 23, common specifications. Through delegated acts, the European Commission will provide for new adoption domains, for new areas of the format, what is needed in order to create the standard way of exchanging data. So, how is Expand-EH supporting this process? The first thing we need is common specs. So on selected adoption domains, adoption domain is e-prescription, a patient summary, lab reports, and discharge notes that we're going to hear a bit more about it today. It's creating the standards and the technical artifacts that are needed to achieve this exchange. But then, does it work? Therefore, we're establishing experimentation areas. We call them bubbles. Experimentation bubbles, where some countries are implementing and they're trying to exchange using the format, and they're identifying obstacles, challenges, which then we take back to the development of the HRX format process. And then can it be applied? So even if the format is clear and everything is okay, does a member state has the maturity that is necessary to apply it? So this is sort of the roadmap we're following down here towards the bottom. We also need to grow the ecosystem. The question I asked before shows how little the ecosystem is engaged in the format. It is important that so few of you were aware of the format and what it is for. And this is not just here in Greece, it's everywhere. So the bubbles, a few things about the bubbles, it's environments where either member states exchange between each other or within a member states, organizations exchange using the format. Evgenia will just in a second explain in a little bit more detail what is happening in Greece. It's down here, it's the Ketekni bubble, so I'm not stopping here. And my very last slide is we have a challenge to integrate the ecosystem. So we're creating XNets, patient associations, standardization bodies, hospitals, and so on, where we're trying to pass on the information about the format, hear for them the difficulties, understand what kind of use cases are being implemented, is the EHR format being used, if not why, what in addition would be needed, and therefore through a process like this, support the uptake and the implementation of the format in real life. And that's all I had for you. You can find more on the project website, and Evgenia will complement with some more explanation of what is happening in Ketekni in Greece.
Hello from me. My name in Greek is quite difficult for foreigners, so please understand that maybe you know as Jenny is more easy to present. I would like to take the opportunity to thank all the organization for this meeting and of course the Ministry of Health, the Ministry of Digital Governance, the National Documentation Center, and then last but not least, HaDEA for this initiative. On behalf of Kt and Mr. Berler, let me permit of Gnomon, who is also a partner in the Xt-EHR project. As Ms. Kolitsi already said, we have about 30 partners, initial and associate partner in Xt-EHR project. And we'll try in a few minutes just to give you a snapshot to what is happening in Greece. Otherwise, I will be really tiring for you to begin extending a presentation. Let's say just we're obliged to say that the coordinator of the project is ICT, which is at the University of Lisbon and the Center of Innovation, and really has been putting a lot of effort in that project because, as Ms. Kolitsi already said, the European Electronic Health Record Exchange format is rather a new issue, an old issue, but has a lot of challenges in creating the ecosystem. The Xt-EHR project, that's already mentioned, is a 2-year project, which is funded by Horizon Europe Framework, almost a budget of 2 million euros. A little bit of Kt. It has a lot of names in Greece. Even in Greece, we are trying to memorize what's the name. It's either Greek DRG Institute, Kt. Or Center of Documentation and Costing of Hospital Services. I would say that for foreigners and also Greeks, maybe Kt is more easy to represent and to remember. It works as and operates as a public interest of non-profiting organization, and is under the supervision, of Ministry of Health in Greece and Ministry of Finance, according to a law submitted in the late 2022. I'm not going to go through the list of the scope and role, just to pinpoint you what is in the red letters, if it is readable for people that are in the audience or even across the online session. The collection of all classifications and terminologies concerning the health sector, the definition of standards of health data exchange, of course, after consultation with national competent authorities, and also the cooperation interconnection with relevant international bodies, apart from theory, is also our scope. That is why we're really engaged in a European project, and particularly Xt-EHR project. Previously had the luck to be also in the Xt-eHealth project, so we do have a legacy behind this project. We tend in all European projects, and not only, to have a lot of acronyms, and we think in the project who is involved that they are supposed to know every acronym. For the Greek native speakers, bubble is rather a negative word, let me say, is fouska, and as you may know, bubble gum, it comes like you have an explosion and then it's poof, nothing. We hope that in Europe, in the 30 partners that are involved, and especially in the 6 bubbles that are incorporated in the project, we are not going to end with nothing in the end. So the ambition is really high, is not only Kt in that, is Gnomon as well, as already mentioned, the management of this entity has a lot of legacy in European projects. We are trying to have a feasibility demonstrator in a very sensitive, and let me permit why I say sensitive subject, hospital discharge report letter. In Greece, we have rather multiple, let's say, hospital record discharge report letter, either for patient or physician, that ends up to the end user and also incorporates in the DRG system, because I already mentioned we are the Greek DRG Institute. So more or less is descripted, alphabetic, but numerical, but not structured and coded. To our knowledge and also our surprise, a lot of North countries, as we spoke during the project, had similar problems. So we are not the ones, let's say, permit me to say, the chaotic ones in having the discharge letter. So the ambition here is to use the use case, either from organizational to national authority and vice versa. And just to let you know, for hospitals are considered organizations for the sake of the project, and the national authority, Kt, is not the Ministry of Health. We're not going to say it's the supervisor of everything. So what we are trying to do, to try to respect the exchange format, and as already Ms. Kolitsi mentioned, the specifications are not even known to the really users of the project. So we're trying to collect in a structure and coded information, all data that we have on patient administrative data from the Greek DRG
data set. It's a data set that is well defined. It is a law behind that. It's not just data that we collect in a very anonymous and encrypted way to collect the relevant clinical data from ICD-10 Greek modification and also from the classification of medical procedures. Is the acronym from GPMC, as said before, according to specific Greek coding guidelines. What the scope further, our scope is to achieve the fair remuneration for given hospital services. This is the one bubble. So it's actually what we're trying to collect in a document, in a single document that comes from hospitals to Ketechni, along with the support of Gnomon in terms of how we are going to implement in the European electronic exchange format. The other bubble is a little bit, let's say, and sorry for the big and the list you have in this project, but we have to, let's say, a little bit further when it comes to this data that come in a single document, how we validate and we proceed back to the hospitals, not only giving them a DRG, but also any other patient coded data anonymously and, of course, encrypted are needed for the procedures. And also to have a single and provide discharge data in the case of care transition. We have a lot of islands in Greece, as you may know, and in other countries. So the ambitious project here, not only for Expand the AIDS, is how a patient who is already hospitalized in one region has the possibility to be transferred or even hospitalized in another region of Greece in an island. And that's the case that we need patient transfer data to be included for the continuity of care. And I hope I didn't have the chance to give you a lot of, on a snapshot, as said in the beginning. You may share, as also previously said, the site we have for the project. I would like to thank you all, and sorry for being late. We are all tired, but I think it's a great opportunity to at least have a grasp of what we are doing in terms of this framework and this information day. Thank you for your time.
Thank you very much to both speakers for this presentation of the last of the 4 projects. And just to comment, I think Bubble may not have positive implications in all languages, and even in English it's not necessarily positive, but I think what it conveys here is the safety to try things out and to progress. Yes. Without those barriers of the risks. I think what these projects, at least to me, have brought collectively to my attention is the vastness of the challenge. There are so many things to work out, so many stakeholders to work with. The European Union, member states and Commission and Parliament have decided on a regulation creating this space, but everything needs to be built. The potential is really very exciting, I think, for patients, although they probably don't know it yet, for other actors in the healthcare area, but also for research, of course. And so I think this is part of the challenge that collectively we face to convince those potential users and help remove some of the barriers and progress. Having said that, we have still a few minutes, very few, if we want to keep to the schedule. I wonder if anybody in the audience wants to comment or question individuals or collectively the panel on this challenge that we are discussing today. Yes, please.
If I'm allowed, I would like to extend an invitation to the audience. If in any way, through your position or tasks with implementing the health data space, you would like to exchange with other member states that have similar challenges on either on data quality or the HRX format, but also other topics as well. Please contact Mina Boubaki or come to me for more information, because the Commission is funding this activity at the request of the member states. It is a very complex environment, and we can learn from each other, within member states. So it's not experts that will be teaching you, it is other member states sharing experiences with you. So this is an important activity, and it's meant to build capacities in the different member states.
And maybe a last point to the panel, including our online speaker. If are there any immediate ideas that this conversation has triggered to this discovery of the other some of the other initiatives, because there are many in this space. Are there some ideas that might push you to talk to each other a little bit more than you are already?
If I can start, to be honest, several of us belong to the same projects, this group of projects. But it is, I think we are in need of bringing the European experiences to the member state level. So for me, it was very refreshing listening to the HDAB, for example, project in Greece, because there's so much learning to be transferred. And that was the most important learning for me today.
Please.
Maybe something that's common sense, but try not to be in the silos of our projects, but to have the possibility really not to be repetitive for 1,000 times, because history is here, history is going to be, but at least we have to have one tangible result in the end, even though it could be a demonstration or a scenario. Try not to be not repetitive and also in our little basket of thoughts.
That's sound advice, please.
Yeah, I think these suggestions are very good. I think what I've said before, the community of practice is a really important and very good tool that will help us along the way. But what there is now set up at the European level, it will be good to also take into account and also utilize here in Greece as well. I mean, as it has been said, we are an ecosystem on our own here. We meet each other in different events, different occasions, but it's not enough. I think we can learn from these examples, with these outcomes that different projects have, and try to use them as even preparatory actions for the projects that we are doing. I mean, we want, for instance, data to start utilizing in our test environments, in our pilot phases. So why not also get some of that from the different projects that develop that? So things like that.
Indeed, thank you very much. All right, then I think I will take this on these positive and encouraging words. I think we will end this session here.
Good afternoon from us. We are pleased with Jean-François to start the session on dedicated to digital programs. And yeah, while we are putting everything in place, just to say that this is a Q&A session, a discussion between that we will, let's say, we took good note of your questions, and we have the two of us presentations. We try to keep it as short as possible. We hope that through them we will address your questions, and if not, at the end we will manage to have, let's say, 10 minutes for questions and answers. And we also committed, both of us, to finish, including Q&A, the session in 45 minutes, so you know where you stand. All right, and with this, it's my great pleasure to introduce Jean-François Juncker. We are colleagues in DG Connect now. He moved to HaDEA. He's a very experienced and knowledgeable colleague. He is deputy head of unit in the unit managing, let's say, most of the digital programs in HaDEA. And we are very pleased to share this session.
So thank you very much. Good afternoon, everyone. So indeed, so we have received some elements where there was a desire to have some clarification. So we will try to be as clear as possible and explain a little bit, in particular between the three digital related topics or programs that mean Horizon, Cluster 4 in particular, Digital Europe program, and the CEF. And to answer several of the elements related to that and how to make at the end a successful proposal. Really, the scope is to go to practical implementation and participation in calls, guiding you with some tips and trips. What is important also to understand that here I have something like 20 minutes to talk and to present. So don't expect me to go into the level of details you would get if you go to a full Info-Day sessions where they will start to enter into deep discussion and of everything. And this takes normally a day minimum. So don't expect all the details. I will touch on elements, but I will try to be as clear as possible to help you to understand where are the best program related to what you have intentions to do and how to try to improve your success rate and capacity to be successful when you participate in a consortium. So if we look first at the three programs, and if we look at the commonality and the differences. So Horizon, so here I will repeat a little bit what was said earlier this morning, but I think it's important, and maybe I will also use different terminology to try to explain the programs. Horizon, it's a research program. So the purpose of the program is really to create new knowledge and to share this new knowledge in order to build up momentum that will have snowball effects and that will try to trigger evolution and increase of the knowledge we have inside the European Union. It's a very open program that really supports all actors within the European Union, but also beyond with all the associated states, but also enabling also others if they have something to add and to provide us to participate with us in those programs. Horizon, it's a massive budget. Well, if I remember well, it's nearly 100 billion euros over the 7 years of the financial framework. It covers many, many, many topics. You saw earlier the full slide that explained the whole structure. It's quite complex. Cluster 4, it's a small box within that big box. So it's really very complex, cover many things. Digital Europe, on the other side, I would say it's completely the opposite. It's extremely narrow, it's extremely focused, and it is not research, in very simple terms. Elizabeth, you explained it a bit earlier this morning. What is fundamental to understand with this program, it's an industrial program. When it was designed, when it was thought inside the DG Connect, the purpose was to make sure that Europe regained production capacity, and I would say it was before the COVID crisis, so we were a little bit seeing in advance what was going to happen. We wanted the European Union to rebuild its industrial capacity and leadership in critical digital sectors. So the purpose is not to cover everything that is related to digital. It's on contrary to focus on few elements that can have a dramatic spillover effect beyond the topics that I addressed. So if you look at the 5 original priority plus the 6th one that has been added recently, you really see high-performance computing, you see data space, you see chips, cybersecurity you need for that, and the skills to make sure that we have also the intellectual capacity to use what we're going to deploy, because you will invest into the deployment and onto certain infrastructure. So the program, contrary to Horizon, it's extremely specific, extremely focused, and it's really aimed at the full deployment and operation of activities. So if you would go to the TRL thinking, while Horizon might go up to TRL 7.8, the depth start at TRL 7.8, but goes to really take some further few topics covered, result of research, implement them, but really it's about implementing and setting up the infrastructure. Connecting your facility, it's a bit similar to the depth. So it's again more an industrial program. It's about making sure we have the telecommunication network we need of the highest standard, but also of the highest security standard. That means that also we will cover in the CEF the quantum communication, but also it's to make sure that we have the 5G deployed, in particular in the cross-border, so that we can have, for instance, intelligent mobility and cars that can travel across the borders, and that would not stop all of a sudden because you reach the border and has difficulties to connect to the follow-up network, but also to have the underground and the high-speed connection that you need and the security related to that. So if we go now to a graph that was shown to you, I think this one really, for me, illustrates extremely well the political and the different funding program and how they complement each other and how they interact with each other. The objective is this digital decade compass. This is what we want. This is what the political master told the Commission we need to do. And for that, we have different program and funding capacity. Horizon, bringing whatever is needed. So it covers many different elements that will provide whatever might be needed in the coming future. Digital, so connecting your facility will provide the underground communication infrastructure, while the Digital Europe provide that make the infrastructure, the IT infrastructure, in order to use the knowledge and to create then additional services and additional value. So I think with this, I've tried to explain in few words the complementarity between the different programs and how they work and act. So what are the different of instruments you have? And the instrument, everything is related to the financial regulation. This is our legal umbrella under which we can finance. And in the financial regulation, it talks about grants and procurement. Very simple, nothing more. However, if we go now into the different program, we have labeled those instruments in order to reflect what is intended inside the different program. So under Horizon, for instance, we're talking about the research and innovation grants, or we talk about innovation actions. For the research, you have a funding level of 100%, while for the innovation actions, you have 100% for the non-profit organization, but only 60% for the other organizations. Then you have CSA, coordination and support actions, and you have other kinds of instruments that are also used, like price and other activities that you can also finance with this. But the main two grant elements are related to the research and innovation elements. If we go to the depth, we have again grants, but the word used are different. So we're talking about grants to cover, let's say, simple grants that cover, and I know you will present it, Elizabeth, later. So that's why I will not enter too much into details, but we have the simple grant that cover 50% of the cost. Why only 50%? Because we are closer to the market. So the intention is that we need to have you, the actors who participate in the course, to invest on your side. Now, as it was explained this morning on the synergy, this 50% might be covered by other funding programs. If we go, and it just for the matter of time, under the CEF program, the terminology is again different. We're going to go about CSAs, classical, but then you have what is called works. So it's basically grants to execute certain works. And there the funding level varies significantly. It goes from 30% up to possibly 75%. It depends on what the purpose of the call is and what the funding desire is and how much we want the actors who participate in the call to invest along us. I will not enter more into that. There is one thing, yes, maybe I should have mentioned in the different program. It's the participation rules for non-EU beneficiaries. While in Horizon, it is still fairly open, you have many capacity. Under CEF and DEP, because it's also explained by Elizabeth earlier this morning, the condition can be quite significantly different. Those programs are really designed for developing European capacity and strategic autonomy. So we must make sure we use our capacity, we create our capacity, and we support our capacity primarily. So the programs are specifically done for that. Under the DEP, you have the famous Article 12.5 and 12.6, which might create some limitations. Pay attention to that. Under the CEF, there is similar, and on the Horizon, in fact, there is also now, I think, an article related, similarly, creating possibly also limitation. And this means that if you want to have non-EU member states in CEF and in DEP, you need to make sure that you keep an eye on what are these associations agreements that exist. There are few, they exist, it's all published, but under the DEP, for instance, will also vary according to the specific objectives. Some specific objective will be part of the association, while others will not be. Typical case, cybersecurity very often is excluded from any associations. So really pay attention to that if you want to participate in those. I'm really trying to go fast, but here we'll start to go a little bit faster. What are the open calls? So at the moment, here are under the DEP program, the calls we had this year. So some are closed, and in fact, we have started now the evaluation. We have 2 calls open at the moment, and I'm just moving just to make sure I remember specifically which one they are. So one, it's related to the blockchain, and it will be a grant to a nominated beneficiary. The reason being that we intend to continue an activity with a specific beneficiary who has been executing the activity up to now, and we will continue. So for simplification, administrative simplification, we go for the named beneficiary. But then there is another call open to anybody related to the digital wallet and digital identity. It's a follow-up of a call that we had already more than a year ago, 2 years ago, for which now the purpose will be to extend the use case that were developed by the pilot. We have today 4 projects with many member states, and the intention will be to go beyond those 4 and to execute. The call, in fact, has been delayed several times because the specification that had to be agreed between the member states, the parliament, the council and the commission, it took longer than expected. They have been published only at the beginning of this year, so everything was delayed a little bit, but now we are catching up and the call is open and will be closed end of the summer. On the horizon, again, we have only very few calls open. So the Quantum flagship have some calls, so we're not in charge of them, but I have mentioned them here just for a little bit completeness. There will also be a call for the NCP network, so the renewal of the NCP network contract we have. So this to make sure they provide you all the support you need. And then we have a call that has been reopened because when we had it, we didn't receive any successful proposal. So it was decided to keep the call, but to reopen the topic, to keep the topic and to reopen a call for it. It's related to the human-centered and ethical development of the digital, to make sure that the digital transformation we see in Europe will also respect the different human values and values of the European Union. Currently on the CEF, there are no open calls. There will be open calls, but at the moment there are none. Now, so you see there are very few calls, if I'm not wrong, that's more or less what we have that are related to digital. What do we know now about 2025? And you will be very disappointed, there is nothing available. So I cannot say anything about the future. But as it was explained to you a little bit this morning, in fact, for the 3 programs, the timing is likely to be the same, meaning that the work program should be adopted end of the year, beginning of next year, with a core launch beginning of next year. And then we will launch the evaluation. So let's say the deadline, the evaluation, and so on. So just for you to keep an eye on it, today we cannot tell you anything. Certainly HaDEA cannot. Maybe Commission could, but at the moment we're really far too early in the process. Also, we have to see the result of the election. So there are many elements that are making things slightly delayed. So last point, and I will maybe go very fast on this just for the sake of time. So how to make a successful proposal? There basically, so the slides will be given to you, and you can see that virtually for all the points there, you have a link and a web page. So there is a massive amount of information to help you to prepare a proposal. Of course, if you're a newcomer, you will feel drowned by the information, you will get lost, and that's why you should participate in Information Day to see. You should also seek, and the participant portal will enable you to find other potential participants and beneficiaries. So you might want to join a consortium, bring your knowledge and your capacity to participate in a call with somebody else. I will not now start to enter too much into detail of this. There is a lot. Here I had several slides explaining you step by step what you can find on the participant portal. What is excellent for everybody, that all the programs are using the participant portal, meaning that you don't have to understand the complexity and the complexity of the implementation. You heard that the DEP, for instance, is implemented partially by us, by the Commission, by the Competence Center, by JUs. Participants don't need to understand that complexity. It all goes through the participant portal, so it makes it far easier for the people outside how to deal with it. So that's a good news for everybody. Go to the participant portal, you can find the information, get familiar. I want to go basically to this aspect. So the evaluation process for all the programs, so the 3 programs I'm talking about, is extremely similar. So once we receive your proposal, the first step we do is to check the eligibility of the proposal that we received. So do you have met all the eligibility criteria that were defined in the work program in the call text? They are defined there. We must make sure that you fulfill them. Second important step is involvement of experts. It was said to you, don't hesitate to register yourself to be an expert and to be called by us. It is indeed the best, by far, way for you to understand how proposals are crunched by us and how to write then also a good proposal to go through this evaluation process. However, only very few are selected when we do evaluation, so you might not be selected, but nothing. It's free to register and you might be called and paid to participate in the evaluation process. Once we have the result of the experts' assessments and what they have agreed together, and we really, at the end of the panel meeting so that means the whole evaluation process, we remind the expert that the purpose of the evaluation at the end of it is to select the best proposal we have received on the table, because our purpose is to finance the best one. So when you write a proposal, don't forget you're in a competition. So it's not a matter to be good, it's a matter to be better. And really this I insist each time I explain, don't forget it's a competition. Some topics we have a dramatic oversubscription, meaning you have a dramatic competition. Some others it's a little bit less competitive, but really for some it's extremely competitive. So keep this in mind, it's a competition. So don't expect the expert to interpret what you might have been thinking in your proposal. Write it down so that they will understand that you know what you're doing. So really don't expect the other way around. I insist heavily, it's a competitive activity and make sure you have the best one. Criteria, I mentioned it just to say you will see they are extremely similar between the different programs. So under Horizon, you have excellent impact implementation. Under DEP, you have relevance, implementation and impact. So you see that it's very under CEF, you have some additional element of evaluation because of the nature of the program. Now, that's my last slide. I hope I have not been too long. When you write a proposal, make sure you have the best consortium for your proposal, for the objective you have, but don't have an excess of members. The excess is deadly usually for proposal if you have people there with no clear objective. Pay attention to the page limit. We still see proposal being a bit too long. And what we also start to see people playing with the font and the size and things like that, just to try to compact more onto the pages. So this, I think something will happen. Make sure you have to write according to everything. The last point I really want to stress to those who have not used debate in CEF and in DEP, read not just the work program, read the call text. There is a lot of additional information relevant for the evaluation, as I said, like eligibility criteria in the call text that will not necessarily appear in the work program. So read all the text to make sure that you have understood it and you will respect what are the different elements when you do your proposal. And the last point, don't wait for the last minute to submit your proposal. It's always the case, frankly speaking, and I always preach, don't wait for the last minute. If there is a communication problem, it will be your fault, 99% of the case. We take responsibility when it's on our side, but when it's not on our side, tough luck. So don't wait for the last minute. You will not improve your proposal dramatically during the last 24 hours. So make sure that the whole consortium work and make the proposal well on time. Don't wait till the last minute. It's stupid to miss because you have some technical issues, and we see it happening still. Huh? So it's frustrating also for us. And I will stop here, really, not for the sake of time. I think I've been longer than I wanted to. Sorry, Elizabeth.
Okay, thank you very much. I will suggest, if you agree, then I continue, and then we had promised, and we will keep our promise, have time for questions and answers at the end. Is it okay like that? Great. So this is my presentation. Perfect. Thanks. I know that I spoke myself about the 6 specific objectives of Digital Europe. I will focus on Digital Europe. I may give you, however, some information on open calls for both Digital Europe and Cluster for Horizon Europe, if you wish to. But I want to say that I spoke to you before about the 6 specific objectives. But if I kept this slide, it's because I think it's interesting to see that we try to do it as simple as possible. You can see here 1, 2, 3, 4, 5 cycles, and each of them represents a different work program within the Digital Europe program. So the first one is joint undertaking Euro HPC. The second one, I take the small, is the Cyber Center, still not fully operational, but that is a detail who is operating for the moment, the Commission, but soon fully the Cyber Center. Then we have the CHIPS, which is a new joint undertaking. And then we have the big, if you like, work program with everything else, but European Digital Innovation Hubs, which they have their own due to their specificity. Next, please. So then here, okay, in the slide I presented before, again, I say what Jean-François said, that, okay, I give you this information, but you in any case, you care about a work program that is open and you reply to this work program. Now, it's good to have an idea on the architecture, but it is not something that you are required to do something about it, anything about it, but only to be alert that besides the main work program, there are others. So that's point 1. Point 2, again, it cannot be stated enough that differently than Horizon Europe, Digital Europe, as François said, and I repeat, it does not has all of the information on the work program, because in Horizon Europe, you have the work program, everything is in. No, for Digital Europe, you have the work program and you have the call documents. Also, for the Digital Europe, we often, that happens to other programs, but anyway, publish the program before the actual opening of the call. So you can see the program, the work program available, but you cannot apply until the moment that the call really opens. But that gives you a time to prepare. So now in this slide, it shows you the relative importance of the several, indeed, implementing bodies of Digital Europe. We explain why we have many implemented bodies. It's a program that it's in which private sector member states play an important role. there is a flexible on that part program, and at the same time, a bit complex. We know this. But, you know, flexibility, complex, all of that cannot go, you know, you gain on one, you lose on the other. So here you have a big share is this deep green, and it is Euro HPC, an important one, specific priority one. Then you have the ECCC, again in green, you have the chips, so you could see roughly they make 50% of the budget. Then you have the deep blue, where it is DigiConnect, so it means the European Commission directly. Then you have light blue, which it is HaDEA. And then you have even lighter blue than other DGs. And then you have some other bodies, maybe most interesting Destination Earth. Anyway, just an overview of the program. Next. So here again, it may be that some of you saw this slide, which took us, I mean, why we have it, why we keep showing to you. First of all, because as I said, as the program is flexible, new things are added. Here it is a slide that has inside all instruments a type of functions of Digital Europe program. And we thought it is important that you have it all together. You can see that on the, depending how you look, on one side, you have the grants. And there are, we call it grants for capacity building and deployment. And we have grants for coordination and support. On the other side, we have single entity procurement and joint procurement. And so on. The grants are subdivided on grants for procurement and simple grants and grants involving what we call FSTP or financial support to third parties, and I will come to it. You see that in this part, which is an important part also of the program, the funding rate is 50%, in some cases only 100%. And for the SMEs goes to 75%. For the reasons explained before, it is not a research, a deployment program. Then on the right side, you have procurement, what is an important part as well. And there is single entity or joint procurement, indeed something that it is rather innovative for a European program. So and then we even put lump sum grants and framework partnership agreement. So you have all of this, and it is always updated, and you have them together. I think it is very helpful. And we present it because we have to make it from the beginning of the program. It's a new program. It doesn't have the same instruments and actions as other programs. And this is why this slide continues today, 3 years after the launch of this new program, to be important to present. Next. I refer before to security and strategic autonomy restrictions of Digital Europe program. You know, it's not the only, just to put it in context. Horizon Europe, as François said, has Article 22.5, which is activated often in Cluster 4, and CEF has the Article 14.6, also activated in different parts of the program. Focusing now on Digital Europe, we have the 2 articles said before, and for the reasons explained before, and indeed, you can find the information in the funding and tenders portal, and you could find information in the call documents for each work program. The decision on which topics are to be restricted partly derives from which specific objective these topics reply to, and partly on the discussion between the Commission and the Member States and the Program Committee. So, entities now assessed by the Central Validation Service as EU control, no problem. As non-EU control, if the Article 12.5 is activated, are excluded. If Article 12.6 is activated, but that is known before you submit your proposal, then there is a possibility with a guarantee for the concerned member state to participate. I spoke before about the guarantee, but if you want, we come back, then we save that for Q&A. Next, maybe. So then again, a slide, next here, in which it shows where the two articles are activated, possibly, on topics replying to these specific objectives. And now we added SO6, of course, because it's semiconductors, you can imagine. It will not be very surprising to have restrictions there to protect Europe. Great. So next, again, looking to the, thanks. Looking to the, trying to reply to your questions, you mentioned EDIC. Of course, I heard your presentations. Some of you are well knowledgeable about it, but just for everybody, it's not EDIC are different than the joint undertakings. They are one of the means for implementing multi-country projects. They are not EU body, are flexible structures. There are, of course, some rules. They are set by a commission decision. For instance, a minimum 3 member states need to participate in an EDIC. And here on the slide, there are, I think, some useful, for those of you not so familiar, specification about the EDIC, about it, who is voting, and how much it could last. There is not an end date for an EDIC. Next, maybe. Then also to say that it should remain open for any new member state, and also third countries, international organizations, other private bodies could become members without outvoting member states. So next, I think I have to, if I have to have 2 examples, I give you 2 that they are finalized officially, if you like. And this is the Alliance for Language Technologies, and the other on local digital twins, Cityverse. There are 2 examples we can give, but we know, I mean, you know, as I do, that Greece is involved in preparation, like the Cybersecurity Skills Academy and Impact EDIC. So again, a new feature replying to the needs for more flexibility, which member states have more possibilities and flexible approach to address common issues. Next, these slides, you saw it before. I keep it here because synergies were mentioned many times. I think I don't have too much to say, except that this word, poor word, synergies, is used in many different contexts. Is used inside the program, across rather similar Commission programs, between programs of EU level and programs in member states, so it's used many ways. And every time, different rules apply. Is it something new? No. In previous MFF, we could even think to put things together with funding from different programs. In this one, there is a sincere attempt to do it. And there is a discussion. And at the same time, we see the difficulties. And on that, I want to say that I can give you, I try to find a positive side, and then in the next slide, there is an example which I think it is a good one, on AI, in which we have projects develop tools to support European law enforcement, and they are financed by the Research Framework Program. And on the other side, we have a project which is called Empower, and it is building on the research, low TRL, as Francois explained, up to 6.7, but then it comes with 6.7.8 TRL to deploy and test the AI-based innovative tools in an operational environment. I think that is a good thing. Then I know that there are other cases. I, on purpose, decided to not put you on this presentation. I will speak to you about it because we know what functions, what is not. But I cannot, some things, this presentation is public, I cannot go stating some of the things. In the same way, I can give you this example. So, I take the example Digital Europe ERDF. You know that in the call for proposals, first of all, now in this MFF, you have call for proposals with these things are mentioned. This is a step. I think it will take the next MFF with new rules, then things are a bit more operational. But if you look to the work program that it speaks about Digital Europe combination of funding and ERDF, you will see that there will be at the end, yes, there will be links, but there will be two different grants, not one, because there are different rules, because ERDF is not the same like Digital Europe. Still, this MFF provides for links, and I think when you evaluate projects like this, there is a plus. Sometimes actually the links are requested, but it's not yet as simple as one could imagine in an ideal world. I think situations like this you have in all member states between your programs, so it's not only at Commission level. But that is something that you see in work programs, so let's say is in the making. There is another case, and you asked us to speak about. It is the synergies with RRF. Okay. RRF funds cannot be used to finance digital grants today, because the way things are constructed, and if someone wants to benefit from RRF and Digital Europe funding opportunities, projects must be designed as different actions, clearly delineated and respected and separated for each grant without overlaps, to respect general EU legislation and try to do the maximum to avoid double funding. So, yes, I believe that going now in the Commission and everywhere in all the EU bodies and in the member states, there is already the processes looking also to the future. Things like this will try to be easier with everybody, in the interest of everybody. But right now, some of these things could not yet function in the simplest of ways. That's clear. So now there is another issue you have asked, and I put some things here, and this is the next, is the financial support to third parties. Don't be afraid. I do not plan to read what I put on the slide, but it's something you can keep. And here it is, you know what is financial support to third parties. Often it could be that in a grant mentioned in the work program, it speaks that this specific grant could also open a call to give financial support to third parties. These calls has to go to the funding and tenders portal, and there are specific rules about it, which are always explained in the work program and the call documents for Digital Europe, and you need to look at it. Now, in anticipation of a difficult question you may ask us, I tell you I'm prepared. You may say, what happens if we have an FSTP in a restricted call? That is a difficult question to reply, but I can tell you what it happened right now for the moment, to say we are working on it to make it different. But if there is a topic and inside it says that this grant could open a call for FSTP and this is under a restricted call, the entity, the partner who do this has to comply with some rules, and it takes under its own responsibility to make the assessment. Because financial support to third parties are not assessed by the CVC, the Common Validation Service. So this is additional. Of course, it's an obligation to respect EU rules. Of course, there will be an assessment from the Commission, but it's not the Commission who will do this job. So that to take it into account. And I want also to say that I forgot to say about, it was mentioned on synergies, it was mentioned as an important example, European Digital Innovation Hubs. There are, I said, 7 in Greece. I can mention Smart ADCA, just to mention one, but I have the list of the 7. I think our important structures are here, are in the country, and are made to help startups and SMEs to become more digital. Also are a part of a network inside the country and outside the country, and the total number of so far European Digital Innovation Hubs financed are 151, and we will have in the future calls to finance more. Now, in relation to the calls coming for Digital Europe, what I can say is that for call 6 of Digital Europe, Work Program 23-24, you know that the deadline is 29 of May. For call 7, the opening of the call, not the publication. The publication, it will be 1 month earlier, but the opening is the 4th of July 24, with a deadline 21st of November 24. For this call 7, we will plan to open it, so you could see what it's about, 1 month earlier. So it means in June. And I said before, and I repeat, we will have an NCP training on the 21st of June. You are the first to know, because we decided yesterday, about this call 7. So then for 25-27, we said what we know, and then for Horizon Europe, cluster 4, there is an opening of a call on 15th of November, but I think I'm sure you are following all of this for cluster 4, and I have for cluster 3, for those of you interested in cluster 3, on the 27th of June. So I'm sure you can find all of this. I'm just said here to alert you. And I think with that, I stop, and we have like some minutes for your Q&A. Thank you. And I think the floor is yours. We were clear, not detailed enough. How can we help in any way? We will be very happy.
Okay, hello. I'm Dr. George Zafoulas. I'm a medical physician working. I have worked in Digital Europe through my university and also through a municipal agency. There is, I don't know how you have, because you have the complete picture, how you have dealt with other member states. For, as you mentioned, the funding raise is 50%, since they are mature solutions and services. But the problem is that some flagship projects where the governmental agency have to participate, they require co-funding by the member states. And that's why when you make this call, like the DIHs or the TFAIs, you have a list of countries participating, countries not participating with the co-funding rate. And Greece, for example, participated in the DIH, and we had many, as you mentioned, in the Digital Europe, many proposals and beneficiaries. But in TEF, for example, AI, Greece didn't decide to co-fund, and so we didn't have any participants. I don't know how you have deal with other member states, the fact that they don't contribute to that major flagships priorities, so whole countries of EU don't follow the general topics.
I think I'm not in a position to reply to this, because to give you examples and tell you what happened in other member states. What I can do is to see what information we have, and then make it available through your national contact point to you. That's what I can do. But I don't want to adventure myself right now, imagining a reply to what you are asking me. More sure way to reply to us, and we also could put it, depending what we have in our training, is to send me your question. So I am sure I reply to exactly what you want. Okay? You have my name, huh? And this of San Francisco. Okay.
Hello, name's Henry Scott from NCP coordinator at EKT. Just on a previous slide, you were referring to funding for financing of third parties. Is that like equivalent to the subcontracting in Horizon Europe?
There is a difference between financial support to third parties and subcontracting. It's not exactly the same rules. So, and we have subcontracting also in Digital Europe, but this is not financial support to third parties. For instance, for subcontracting, we assess through the central, if it is a restricted call, through the central validation service, we assess ourselves the control, non-control issue, when it's not the case for financial support to third parties. It's a bit different, because then subcontracting comes as a reply to the call from the Commission. When this is financial support to third parties, is mentioned in the work program, and the consortium who wins the competition, it has itself to prepare a call to put it in FNT portal, funding and tenders portal.
Thanks,
so
thanks for the clarification.
And here you have exactly what is the FSTP, and you see the difference with subcontracting. So, okay, there is no more questions. Okay, we can say also you heard quite a lot from all of us since this morning. And I think we managed, I mean, okay, I cannot say we were very, very fast, but we were not very, very slow neither. And so with this, I think maybe if you agree, it's time for coffee break, correct? And I think it's a very welcome coffee break for all of us. Thank you very much for being with us. And we are very happy again to be here and share with you whatever knowledge. And we stay available. Thank you.
So, good evening.
Almost.
We're getting there. Congratulations for staying on that long. Also, if you're online with us still, I'd like to welcome you to the last session. Oof. This time we're going to talk about cancer, and in particular, again, here the potential synergies that we have between the programs that are funding efforts to addressing the cancer issue at European level. Just by way of framing the discussions, as you know, cancer is one of the main priorities of the European Commission in the health area, in particular with the Europe's Beating Cancer plan that was launched in February 21 as the EU's response to the growing challenges and developments in cancer control. This, of course, in the aftermath of the pandemic was made worse with delays in diagnostics and treatment. The cancer plan is built around a number of flagship initiatives, also linking up with other initiatives, and we talked about the digital elements. We also will mention the cancer mission. So the idea is that we support EU members in their work to prevent cancer and to ensure high quality of life for cancer patients, but also for survivors, their families, and carers. And thus, the cancer plan is structured around 4 areas where the EU believes it can add value. That is in prevention, in early detection, in diagnosis and treatment, and in the quality of life of cancer patients and survivors. As I said, the EU is contributing to this both through the EU for Health program and through Horizon Europe program, in particular the cancer mission. The cancer mission has a number of objectives in understanding the disease, prevention, diagnostic and treatment, supporting quality of life, and ensuring equitable access. And just to say as a final word, through the ongoing programs, through the EU for Health program, there are more than 40 ongoing projects. And through Horizon Europe, there are 50 projects launched through the 3 calls for proposals specifically for the cancer mission, for a total EU grants of 393 million euros. As I mentioned this morning, we just launched the 4th call with an additional 119 projects, 19 million for 6 topics. And of course, these are not our first efforts on cancer. There have been previous efforts through the previous health programs and through the previous framework program, Horizon 2020. We already have ongoing projects from Horizon 2020. And we also have other Horizon Europe projects outside the cancer mission, which are also addressing cancer. And today, my colleagues have put together a very nice program, which I will hand over to Georgios to introduce. Thank you.
Thank you very much. So it is also my pleasure to welcome you here and to express also my enthusiasm for this type of roundtable that we initiated, a kind of mini cluster meeting, as was presented by Stefan before. We have a very nice selection of actions funded by the 2 main programs dealing with this area, so the EU for Health program and the Horizon Europe Cluster 1. And with no further ado, I will give the floor to Mr. Alexander Pinzas, who represents the National Hellenic Research Foundation in the JAME joint action under the EU for Health program. The floor is yours, Mr. Pinzas.
Thank you, Dr. Hogan and Dr. Magetidis. I would like to thank the organizers, the European Commission, the Greek Ministry of Health, the Greek Ministry of the Digital Governance, and the National Documentation Center for this kind of invitation in this very interesting, to participate in this very interesting day, Info-Day of the HaDEA Info-Day in Athens. This is something, to my opinion, that it was very absolutely necessary, and this was very well materialized. Congratulations. So on our part, in a very few minutes, I would like to describe to you in a few words, in a few slides, kindly provided by the coordinator organization, Istituto dei Tumori, Nazionale dei Tumori of Milan. Professor Paolo Casali is the coordinator of this joint action, Jane. And from Greece, National Hellenic Research Foundation, which I represent, and the National Capodistria University of Athens as an affiliated authority are participating with almost 30 experts. Jane is a joint action, is about a joint action on network of expertise on cancer. So I can explain a little bit more. about this initiative. These are the contribution by you, the duration from October 2022 to September 2024. The joint action JANE2 has already been accepted for funding. We'll start for another 4 years. We'll start in October or November, I think, of this year for 4 years, maybe November. The beneficiaries of JANE there are 16 countries, and there are also 20 affiliated entities from nearly all over Europe, where it's blue. Now, the context and the objectives of this joint action is very important to me because it's one of the series of complementary joint actions of European Beating Cancer Plan, and the ambition of JANE is to shape 7 European networks of expertise for cancer care-related issues, requiring cross-border cooperation and European-level know-how. Unlike European reference networks for rare cancers and national comprehensive cancer centers, NOEs will provide services and tools to cancer institution networks in Europe. And the main goals is lay foundation and prepare groundwork to launch the NOEs and critically evaluate existing models and current future EU networking aimed at optimizing functioning of new networks of expertise. To me, to my experience so far, this is a unique network with all the necessary disciplines related to cancer, which is even more enriched in JANE2, because JANE2, there are already 29 countries with 125 or 29 participants and entities. So JANE is paving the way to create the 7 network expertise. Their names is complex and poor prognosis cancer, adolescent and young adults with cancer, I say the more oncological networks, also palliative care and survivorship, other networks, personalized primary prevention, and two technological networks, which is omic technologies and high-tech medical resources. So it has a lot of expertise, not only people, but also in resources. Now it has also integration between healthcare and research and patient involvement and AI and IT infrastructure, and we heard before, and has a lot. So just very briefly, the main things. Now, the expected results, of course, of this large initiative, which is very, very ambitious, but very important to me at the end of the, especially at the end of the JANE2 in 2028, is to prepare and to foster coordinated relationships with European oncology community, to find solutions that allow patients across EU to benefit from increased knowledge and expertise and more accessible health services. And this is very important to be integrated in all the EU countries participating. And this is, as it was shared during this day, this is one of the difficult aims always, but we have to be optimistic because there are differences, of course. But on the other hand, the ambition of JANE is to shape effective new network expertise, building on previous and ongoing EU networking experiences and finding solutions rooted in European oncology community. So there is going to be a green paper, European conference, and also healthcare networking could become a privileged hallmark in EU, having the potential to target the health of its citizens in a highly coordinated fashion. We are integrated in this very important joint action as representing the country. So almost 30 experts from these two different ITs are participating and are taking part in the work packages as we are speaking now, but also is going to be even more through Jane 2. So we have the coordination of the dissemination part. Dr. Pletsa, who is here, is coordinating the dissemination work package. We're participating in most of the work packages, NOEs, with clinicians, our clinical colleagues from the University of Athens, on palliative care also, on survivors as well. And on prevention, both experts from both participants, and then omic technologies, mainly in HRF, and high-tech medical resources, which is all the other resources necessary for healthcare, with a lot of research, the pillars of research and innovation on them. And last but not least, the NOE on cancer in adolescents and young adults, which was a separate NOE at some point of the network. So it's very well designed, and of course it's developing, and everything, new things, new developments are coming in, are discussed. A lot of numerous virtual meetings, and of course live meetings as well. And the aim, because we were asked about our aim at the national level, I will not say something really very with a single word, but in Greece we would like to cooperate, to collaborate at the European national level with Jane NOEs, with Crane, which my colleague is going to present in a few minutes, with CCI for EU, which my other colleague is going to present in the next few minutes, to let Ministry of Health bring integrated expected results and benefits described in the previous slide, mainly to cancer patients society. Thank you very much.
Thank you very much for this presentation. Indeed, I note what you said. These are thematic networks, but of a transversal nature and not disease-related, that the European reference networks. And the themes and areas that you highlighted are indeed very important for the quality of care and quality of life of people suffering from cancer. I will now give the floor to the next presenter, who is Ms. Anastasia Badasopoulou. So we have also the regional health authorities of Greece. Ms. Badasopoulou is in the first regional health authority, who is participating in the other flagship joint action in this area of expertise across the comprehensive cancer centers and networks of expertise in the cancer area. Ms. Badasopoulou, the floor is yours.
Thank you, Dr. Margetidis. I would like to thank very much the organizers for this opportunity. It was a great opportunity, first of all, to learn policies, to learn tools, to networking, and also the opportunity to present. So I thank you very much. And just please, I'm going to present the Crane joint action. I'm using the Crane layout, and we are really the cousins of Jane. And for us, the Crane that has duration 2 years, 2022-2024, is a challenge for cancer care and oncology institutes across Europe. We, as first tip of HaDEA, we are the competent authority in Greece, and we took the lead of Work Package 2. An overview on the objective and structure of Jane Joint Action. It is based, the whole idea of this project is based on the results of CanCon, that was a very significant program related to cancer in Europe, and then to IPAC. What was the idea? The units or the hospitals which are providing cancer care should reach a level and a content of the care they provide that is expected to be comprehensive. I cannot say holistic, but at least comprehensive, covering the whole necessary range of service for each patient. And so the CanCon say, let's go for that. So main objective of Crane Joint Action was to prepare the necessary preconditions, either administrative or professionals, and those related to high quality performance towards the creation of networks of comprehensive cancer centers. Then to link all these comprehensive centers and also to provide an assessment on sustainability and feasibility of this very ambitious networking of high quality service units. The participants are 25 countries, 44 partners. The budget is almost 3 million euros. And the Crane work packages, if we leave the coordination and evaluation and WIP, that is dissemination, I forgot it here. WIP 5, the EU networking of CCCs. WIP 6, the organization of the comprehension of CCCs regarding the quality of care. The quality of care, the measurement of quality, the definition and measurements of quality. The WIP 7 is related to the framework and criteria. And the WIP 8 is focusing to the equitable access to high quality care. So it was, they seem a bit overlapping, but you know, it is not exactly like that. All the work packages try to focus in detail in different aspects of what are the necessary governmental issues that should be addressed and should be organized and delivered, and also the relationship, the dynamics between organizations. So we also develop, regarding the sustainability of the project, a maturity model coming from Poland. And this is supposed to be a new good tool for all, the assessment of the project. Our deliverables says WIP 2 leaders, but it is not that important to say what are the deliverables. I just present them. Our affiliated entities, Agios Savas, who participate in WIP 6 and of course WIP 2. WIP 6 is related to the quality. LICO related, WIP 7 related to governance and WIP 2, as well as Andrea Sigros, WIP 7 governance and WIP 2, of course. This is our first web page. So expected outcomes and strategy. The expected outcomes are the establishment of a common and concrete understanding and consensus-based model for what a CCC is. I have to confess that this is absolutely very difficult. Very difficult because of different understanding, maybe because of different interests. They are all in the human nature and in the organization's nature. So I have to say that we worked a lot, the whole countries, especially those who had the tasks related to governance. We have reached a common understanding, and then we are going to the definition of clear recommendation and current, and also we identified the current practices in different countries in order to find what a balance between organizational aspects in all the countries, because what we have, it is expected to deliver should cover everybody and should be characterized by inclusivity and not exclusivity. So, critical concepts and issues we have to face, it was what comprehensiveness mean? How important is the accreditation versus certification in any unit or hospital that provides cancer care? The decision was for certification in order to be broader open for all the countries. One hospital, one division big in a hospital, or more hospitals who are working together. Because also you can imagine big countries, rich countries may have a tendency to say that I have big, huge cancer hospitals. If you do not have, you cannot have a CCC. But then there were alternative positions that have been decided. So now we say that a CCC could be not only one huge cancer hospital, but also a division, like the division we have in Laiko, we have in Hippocration Thessaloniki, like, okay. The number of types of cancer treated, main cancers or all cancers, in order to be characterized something as CCC. Research, yes, research definitely. Quality and standards. So beyond any kind of certification, definition and standard setting was a very, it was the core of the argumentation. For us as Greeks, and I have only half slide, not one. For us as Greeks, it was very important to reach a level that should not exclude us. And we are proud that we think that we have agreed that. So now we are going just one word for EUnet CCC, that is the CRANE 2. We are again the competent authority. We have more affiliated entities, Agios Laikon, Alexandra Attikon, Oncology Hospital of Kifisia, and Biomedical Studies Lab of Aristotle University of Thessaloniki. The idea is that we are getting stronger involved in the governance by running 2 pilots, Alexandra and Attikon. We are remaining in the quality with Agios, and we are also have the co-lead of WIPI5 running the portal of the project. So, going back, our aim is how to strengthen the Greek oncology services, and this is the challenge for us and for the Ministry of Health to respond to the standards and to be on board. And we work and hope. Thank you very much.
Thank you, Ms. Dadasopoulou. 2 remarks. Indeed, these are the first 2 actions we heard of are under one flagship of the EuroBITS Cancer Plan and the mission. So follow-up calls are currently in what we call the grant agreement preparation, with a very significant EU co-funding of approximately 130 million euros for the next funding round. The second comment I would say, I liked very much Jane and Crane as brothers and sisters. It reminds me of a novel by Margaret Atwood, Oryx and Crake. So you could be the title of a novel, in fact, Crane and Jane. With no further ado, I will now give the floor to Mr. Yannis Spirou, who represents the 3rd Regional Health Authority, for an action that spans both the cancer area and the digital area that we saw before, and it's called ECAN, and the floor is yours.
Thank you very much for the invitation in this special day.
My name is Steriani, or in short, Stella Spiro, and I'm representing the 3rd Regional Health Authority, which is the competent authority for ECAN. Just wait for 2 minutes to open the presentation, please. Thank you very much. I'm going to try to describe in a few minutes the ECAN joint action, which is the joint action about strengthening e-health for cancer prevention and care on behalf of the 3rd Regional Health Authority. In short, the objectives of the joint action. It is about the objectives includes the improvement of the healthcare services and the healthcare providers and citizens that may be in front of epidemic and crisis situation to better give the opportunity to the patients that are far away, where isolation of patients is a key element, to use telehealth and digital e-health services generally in order to increase the communication and to be ready to prepare for such situations, and in this means to enhance the knowledge of the healthcare providers, the cancer care workforce, the citizens, the patients in areas that are difficult to reach, or even in cross-border situations where cooperation is already needed. So among these objectives is actually to exploit the e-health solutions. And in this joint action, following these directions and these objectives, pilots, the ECAN pilots, we name them ECAN pilots, are to explore the role of teleconsultation and telemonitoring in a clinical trial focused on telerehabilitation and telepsychological support in different populations of cancer patients. The populations come from 16 different countries in 18 different pilots. The enrollment of the patients in these pilots are, I could say, astonishing, as in a few months they can manage to enroll about 300 patients. In order to examine the patient-reported outcomes and experiences that are monitoring through the dedicated telemonitoring systems. And there the data collected by these pilots, actually by dedicated apps and smartwatches, and generally by innovative e-health solutions, are going to be exploited for policy interventions in member states and, of course, in our country. Sorry for these slides, but actually, let me have 2 minutes, 1 minute to say a few words for the Greek participation. Our consortium is quite a very interesting one and includes partners, affiliated entities from academia, from public sector, and from patients association, which is most important, I could say. So along with us, with the 3rd Regional Health Authority, is the Hellenic Cancer Association, ELOC, is the Laboratory of Medical Physics and Digital Innovation from Aouth University, Thessaloniki, is the CERT from the institution, from the research and technology in the ECAN, is one of the 16 pilots, and I could say of the 18 pilots, and I could say a very successful one. So we combine our strengths because the innovation is actually the scope and not the research, only the research. And besides the technological improvements and developments that especially academia is very actively in this e-health joint action, we have a very important role as a work package leaders. We are the leaders of work package 8, which is about the stakeholder involvement. And our participation focuses on identifying the relevant stakeholders across the EU, boost the engagement of the stakeholders, in several project activities and similar projects, of course, not only ICANN, and increasing the capacity of partners, especially focusing on training of the stakeholders. Also, we intend to keep this an active network of stakeholders. We hope that this work is going to be sustained in the next joint action that relates with this objective. We have also conducted small-scale pilot, as I already mentioned, involving patients with advanced care and giving focus on telepsychological support of those patients through using the e-health services. Our team worked on the design and development of a secure online platform for clinicians that is going to be combined with artificial intelligence AI app. And we have also valuable outcomes of the pilots by conducting a SWOT analysis in the 18 different pilot centers. In this slide, we concluded the work in several work packages during ICANN, and not only work in the work package that we are leading. The key lessons learned regards that telemedicine expertise and capacity vary significantly among the member states. So in our minds, and till now, a structured training is needed, so we are going to focus on this. The management of technical and cybersecurity issues means that there is the need to ensure a continuous management and support of technical support of the pilots and generally of the usage of e-health services in cancer area. And legal and ethical aspects interpretations vary among member states significantly. And in some cases, these variations may become obstacles or barriers for some cancer centers or for some centers to participate in such innovations. About how to use these outcomes, the outcomes of the ICANN in the policy area and especially in Greek area. By the lessons learned and also the recommendations and several outcomes of the ICANN, we could use actually all this for bringing input in designing digital strategy in cancer, in national policy initiatives, and in many other national telemedicine network and legislation initiatives. All the work is aligned with the principles of e-health DSI, not principles, the actions of towards e-health DSI. And as increased, there are many resources that are invested in, for example, RRF, in e-health services. We think that the outcomes could give valuable policy commitments that could be exploited in these actions towards e-health DSI. I can mention that the ICANN gives the opportunity to exploit the secondary use of collected data. For example, the ICANN is going to be used as a best practice in the Xt-EHR joint action. And because it's and can be used in the policy design of telemedicine landscape in EU. So there are many valuable results that somebody could give advice. And I think that some prior policy commitments, especially in the legal and the legal area and the reimbursement of telemedicine telemedicine services regarding healthcare professionals, doctors, and other specialities that are working in these e-health services in cancer should be taken into account to succeed further implementation and sustainability of the results, and not just to have pilots for 2 or 3 months and then finish the work in this area. Thank you very much.
Thank you. Indeed, it is very timely because we know that after COVID-19, we saw through several publications the impact it had into regular care. And it's good to anticipate through such an action to prepare the healthcare system to be able to really use also the experience of the pandemic to improve telemedicine and telecare. Thank you very much. I will now give the floor to Ms. Moshandreu, who will go and present one of the first actions under Horizon Europe. We had 3 from the EU for Health Programme and 3 from Horizon Europe. So it is CCI for EU. And again, the CC stands for Comprehensive Cancer. And there is clearly a link between this action and the actions we talked about, at least the first ones of the Comprehensive Cancer Centers. The floor is yours, Ms. Moshandreu, from the St. Savas Oncology Center, which is also participating in some of the other actions as we saw.
Thank you very much. Good evening from me as well. I would like to thank the organizing committee for giving us the opportunity to be here among such important speakers today. The General Oncology Hospital of Athens, St. Savas, is the first hospital in Greece to have joined the network of comprehensive cancer centers in Europe under the umbrella of the Organization for European Cancer Institutes. With this membership, the hospital is given the opportunity to participate in several international programs, which constitute initiatives of the European Commission for the implementation of the Action Plan Against Cancer. One of the recommendations is to set up a network of comprehensive cancer infrastructures within and across all EU member states to increase quality and quality of research and care. With respect to this initiative, an Horizon project has been developed with the title Comprehensive Cancer Infrastructures for Europe, with the overall objective to strengthen the research capacities of comprehensive cancer infrastructures. This defines the European Commission's commitment to preventing cancer, supporting equal access for patients to the therapeutics, and improving the quality of life for all those affected by the disease. 27 beneficiaries are included in the project, 28 affiliate partners, and 32 countries are involved in total. This project consists of 8 work packages. The first work package is horizontal and concerns project coordination. The scope of work package 2 is to develop a joint understanding, a definition and scope of the comprehensive cancer infrastructures, along with a set of criteria to assess and improve CCIs in all EU member states. The work package 3 aims at collecting structural information and data from EU member states and associate countries on the functioning and organization of cancer research and its integration with cancer care, and about the presence and level of maturity of already existing CCIs. Work package 4 and 5 aim at designing a tailored capacity building intervention which meets the needs of each CCI in a member state or individual region within a member state on a digital program. Work package 6 will implement and follow up the tailored capacity building site visits that were designed in work package 4 with the intention to have positive impact at the individual, institutional, and systemic level. The need for establishing comprehensive cancer infrastructure arises from the fact that the quality of cancer care can vary between countries. The cross-border collaboration will improve patients' access to high-quality diagnostics, care, and to the latest innovative treatments. This action will help to deliver high-quality care and to reduce inequalities across the EU, while enabling patients to benefit from diagnosis and treatment close to home. Thank you very much.
your presentation was a game changer in terms of the time management, so I thank you very much for that. But I also want to say that indeed it addresses one of the dimensions of the comprehensive cancer center approach, which aims us for the European reference networks, which is another example, to address care, but also the research component, the training and educational component. So we see a very nice complementarity, I think, between the actions that we see in front of us, and the forum that you mentioned is enhancing this complementarity. I will now give the floor to the next presenter, who will be Dr. Xt-EHR for the ECOS. If I'm not wrong, it is Horizon Europe. Is it CSA?
Hello again. At this panel, I'm here to represent the consortium under ECOS, which stands for Establishing National Cancer Mission Hubs Networks and Synergies, of course. Let me briefly present the objectives for ECOS. Our basic aim is to support the implementation of the cancer mission across all EU member states and associated countries. If you take into consideration the differences that exist between health ecosystems, research ecosystems, innovation ecosystem across the different countries, you can understand why a coordination and support of all cancer-related activities is actually an understatement in this case. And this is why in ECOS, apart from the traditional cancer care roles presented by several stakeholders, you can see a diverse here participation of employees, municipalities, and other stakeholders that usually are not much represented in other research projects. You all know that cancer has been identified as a societal challenge. You can see the reason why listed here, but I just presented this slide because I want to highlight the political commitment due to which we ended up into major plans: the European Beating Cancer Plan, the Europe's Beating Cancer Plan, and the Cancer Mission. You know that apart from the documents and all this collaboration and synergies and whatever we have said so far, we need actual actions. And this is how we ended up in ECOS. To do what? To help the establishment of national cancer mission hubs across all countries, European and associated ones. This is what we want to achieve. You can see here our model, our governance model, involving all stakeholders. And we want to end up actually in the involvement of citizens in all EU policy dialogues. This is a major game for us. We trying somehow to manage it because it's not very easy. Although, if you count here the flags and the logos, you will see that 28 countries participate in the consortium and representing 57 organizations. 60 organizations and 30 countries, since Bulgaria and Denmark also joined our consortium. You can see here the difference I told you before in respect to the establishment of national cancer mission hubs. There are several countries that where the national mission hubs exist, others that do not have a similar structure, and others that are in the process of building one, establishing one. You can also see that although Greece was in the third column, where a huge no is on top of it, now we are in the middle column since we are collaborating with ELOC, the Hellenic National Cancer Association, in order to transform it into a cancer national mission hub. And this is why the mission is extremely important in its implementation also in Greece. You see at the left bottom of the slide the difference that and the increasement in the percentage levels for the incidence and the mortality in cancer. Between 20 years, less than 20 years, we're going to have an increasement of 11%, more than 11%, and 17%. Why we need this cancer mission hubs establishment? Because we want to take the advantage of sharing the knowledge and the know-how that exists in other countries and incorporate it in our national system as well. Just as Jane and Cranes are brothers and sisters, the same holds for ECOS and CCI for EU. And since I have the honor to leading the task of guess what, synergies, we are more than happy to invite you all at the first Cancer Mission Forum. It's going to take place in Greece in the 1st and 2nd of July. We have been able to, let's say, lock the participation of Mr. Mark van de Bulke and all the other initiatives I mentioned about competence cancer centers, networks, infrastructures. Jane Crane, CCI for You will be there alongside the whole coordination team of ECOS. And we are hoping of being able to create the pathway in order to get there in time and actually create a national cancer plan. And these are our social media. You are more than welcome to follow us. And I'm at your disposal for any questions. Thank you.
Thank you very much, Ms. Christopoulou. Before I give the floor to the last speaker, 2 comments. One, Greece is well known for saying no. We said it in 1940, but now, thank God, we say yes for this type of initiative. And then the second more serious comment is indeed, you mentioned the National Cancer Plan, because we are talking about synergies. We presented this morning the efforts of synergies that the Commission is doing between the programs and trying to help include synergies by design in the calls and other documents. But synergies is kind of like a sandwich. Synergies need also to be built up, and they are built up in an area of cancer. For example, if there is a national cancer plan, then things start to fit together very, very well. So a very welcome initiative. And I'll give the floor to Mr. Anaxagoras Fotopoulos for the last Horizon Europe project that we have invited OncoScreen, who's coordinator from Exus AI Lab. So we do have AI in an action. And Ms. Dimitra Dionisiou, technical coordinator from the health team of the NTUA, which we are going to visit tomorrow, because we are also in this visit, not having only today information day and seminar, but we are also visiting projects on our second day of presence here in Greece. The floor is yours, Mr. Fotopoulos.
Thank you. So, OncoScreen is one of those mega projects. It's on mission cancer, and particularly we focus on colorectal cancer. We talk about 38 partners, 11 different technical solutions, 4,000 clinical trial subjects. So you understand that is a very big project, a very ambitious and also a very challenging one. Its objectives mainly is to provide actually a series of diagnostic devices that are novel, low cost, easy to use, transitioning, let's say, from hospital to home, the diagnosis, at the same time providing a series of decision support tools for clinicians and policymakers, so that we move towards an evidence-based decision. And this is coupled, let's say, with a multi-tier screening program that also incorporates risk-based stratification through the use of multimodal data in order to be more accurate in what we want to achieve in identifying the right risk level of citizens. We don't stop there, but we move a step forward towards, let's say, the viable pathways to examine the economics behind. And okay, as a project, we may have some good results, but what happens after? So we move to the next step to examine not just the health technology assessment, but innovative financial schemes and many things more in terms of exploitation to see how we benchmark based on the current standards of care. So I'm not going to dive into the whole architecture. I just want to mention that the novelty of our tools, imagine that you can breathe and through a device, and this device can say to you whether you have cancer, or to have something like a COVID self-test, but based on CRISPR-Cas technology, and this device can say to you whether you are positive or negative, or through this to have a cheaper genetic testing, and similar things like the circulating tumor cells organoids that we have in order to examine metastasis. So all of these tools are coupled with a series of software tools that some of them are used for training purposes, always in the frame of reducing costs. For example, examining the concept of nurse endoscopists on whether they can join and perform colonoscopies through proper training. So these innovative and novel concepts, if I can say, we can provide great ideas and can move a way forward towards evidence-based decision-making. And this is coupled through, let's say, 3 visualization endpoints, 1 mobile device for the patients, 1 clinical decision support tool for the clinicians, and 1 for the policy makers. The outermost goal, of course, and is what the mission Cancer wants to achieve, is eventually to move and progress our TRL and our innovations towards saving lives. And if I can say, in regards to where we stand now, we are some way in the start towards the middle of the project. We're at month 18, and the clinical trials are already prepared to getting started. We have finished with the architecture, and already most of the tools have already participated in laboratory tests and have generate great results in terms of sensitivity, specificity. But of course, we should expect the clinical study to see what happens. And before I close, I just want to underline also the topic of the session, which is also about synergies here. And I think that, for example, ECOs or oncological living labs that we have in our project are great initiatives where we can discuss how policies can be aligned across different projects. Imagine that we talk about colorectal cancer, and let's say that there are 2, 3, or 4 or more projects dealing with the same type of cancer. Those, they cannot provide different kind of recommendations to the policymakers. So we need to align ourselves, to align our policy recommendations to the policymakers, and I think the right framework, the right platform to do this is, let's say, oncological living labs or projects like ECO. So I think there is a great room for synergies, and not stopping there, we can move ahead, I mean, with a particular topic of the policy dialogue, which is right now in Europe, younger and younger people are dying from colorectal cancer. So we have a huge rise on early onset colorectal cancer, and scientists in Europe still, we don't know why it is happening. So we need to progress more into this, and eventually dedicate enough budget, enough money for screening. And there comes the big question, who pays? Is it the private insurance companies? Is it regional authorities? Is it the nation? So we need to address inequalities, rich versus poor, educated versus non-educated, that have a lower participation in screening, and so. So I think this is just food for thought, and I think we had a great event here today. So thank you.
Thank you very much for this last presentation. Thank you for making the bridge between one huge, the traditional Horizon Europe huge projects with a very strong research component towards the policy, because at the end of the day, all the actions that we co-fund need to feed back into policy, national level policy, EU level policy. I, for one, I'm very, very happy for this session because it enables us to see a variety of actions covering many dimensions. And I think Stefan will also be very happy.
Yes, I'd like to thank the panelists for sharing the progress they've made in these various projects and their excitement about it. I think it was very, for me, certainly highly educative and encouraging to see all this enthusiasm and energy and collaboration going on across Europe. It's always very refreshing for us civil servants working in a big administration, organizing the funding of many projects and monitoring them, to see specific projects and the work and energy going behind each of them. And so thank you again for that. I think we need to close. So perhaps on behalf of HaDEA, I would like to thank all the organizers, all the participants, be they speakers or people in the room. It was for us very educational and very good to meet directly what we call stakeholders, but you're people. So thank you for that, and we hope there will be other opportunities. So thank you very much. Thank you.